Una Recording in progress.
Okay. 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 Honorable members, good afternoon. Thank you very much for logging into this meeting. I'm still trying to adjust my camera here. It will probably work as we go along. I'm Dr. Lomo, the chairperson of the Portfolio Committee. We are in this meeting to listen to the presentations that are made by various institutions, organizations, and individuals who have shown an interest in the tobacco control and electronic delivery systems bill. Without really wasting a lot of time, because we have a long meeting, we'll start by just a moment of silence. Thank you very much, honorable members. We can then proceed. Let me just see what is happening here with my camera. I will fix my camera along the way. So now let us proceed as if the camera is working. I need to show you that I'm not a robot. I'm really in the meeting. Ms. Machalamba, can you assist us to really record who are the members of the Portfolio Committee who are present today?
Good afternoon and thank you, Chair. Present is Dr. Lomo, Ms. Twego, Ms. Shabangu, Ms. Sine, Dr. Liru, Mr. Mutubatsi, Ms. Chirompu Ngose, Dr. Litlape, and Ms. Mhlongo. I've received an apology from Mr. Van Staden. Thank you, Chair.
Okay. Thank you, honorable members. We take that the members who have been recorded to be present will then be marked present in this Portfolio Committee meeting. This meeting, honorable members, though taking place in the virtual platform, will be deemed to be taking place within the precinct of Parliament, and therefore all rules that apply in the committees of Parliament within physical meetings will also apply to this meeting. I would request that at the time you speak, if you are in a good space, do show your video, not like me struggling now. But if you have a challenge with your video, we will then be happy just to hear your voice. Indicate that to us when you speak. We have 5 presentations. I want Ms. Machalamba to now flag the idea. I can't remember them offhand. The first one I know is British American Tobacco, followed by another independent institution, and then 2 other learned professors, and then Ms. Du Plessis, the last one. Yeah, so we have the presentation by British American Tobacco, followed by this one of Independent Community Pharmacy Association. Thereafter, 2 professors, one after the other, Professor Konsantinos, Farsalinos, and the other one is Professor Khayat. The last one is Ms. Du Plessis. If these members are logged in, please do recall that we look at the time allocated. Members may ask you more than what you can really budget for, but we'll still stick to the time. If we see you allocated 30 minutes, you don't have to exhaust all the 30 minutes. But you will not be able to go beyond 30 minutes on your presentation. We will now allow the first presentation of the British American tobacco, and we will allow your presentation, and then thereafter honorable members are going to engage with your presentation, and then you will have to come back with responses. You'll be given less time when you respond, so be aware that you will not have a luxury of too much time, as having seen that as we are starting now at 3 o'clock, our last talk in this committee will be almost around 8 o'clock. So do use your time very economically, and then your 30 minutes now starts at 3:05. Carry on. Thank you.
Good afternoon, Honorable Chair. If I could request for the technical team on your side to enable sharing so that we can share our screen.
Chair, I'd also raise my hand to indicate that I'm present in the meeting.
Yes, you have been granted hosting rights, Mr. Moloto. Thank you.
Okay. Thanks. It will be Stephanie Fenter who will share on our behalf. If you grant, please, Stephanie Fenter will share on our behalf. Can you pick her up, Ms. Machalamba? Okay. Good. We're sharing. Thank you. Okay.
Yes. Yeah.
Thank you very much. Honorable Chairperson and esteemed members of the Portfolio Committee, thank you for the opportunity for us to share our thoughts today and our inputs on the bill that is in front of you. My name is Johnny Moloto. I'm the Head of Corporate and Regulatory Affairs at BAT Sub-Sahara Africa, and I will be joined by my colleague, Dr. Edward Makgotlo, our Head of Scientific Affairs. So we'll do the presentation in two parts. I'll take the first slot on that, but we'll still be within the time that the chairperson has allocated. So before we go into the detail of why we're here today, we just want to state up front that for us, we want to be clear that what is the ultimate success of this bill? How would it look like from a success point of view? And for us, this will entail a significant and measurable reduction in smoking rates across South Africa. So, however, we note with concern, though, that while this bill aims to reduce smoking prevalence, it does not specify what that reduction target would look like. We therefore respectfully suggest that the bill needs for the country itself to have measurable targets to guide effective policy implementation and to assess the bill's success. According to the World Health Organization, a smoke-free country is defined as a country that has a smoking rate of 5% or less. We believe that this benchmark provides both aspiration as well as accountability for tobacco control efforts. So honorable members, with this in mind, BAT shares this goal completely. We are here, therefore, today not as critics, but as industry partners with on-the-ground experience ready to help achieve this objective. Unfortunately, in our view, the bill as it currently stands will never deliver this smoking reduction that the government seeks to achieve. Assessed against South Africa's market realities, the devastating reality is that increasing smoking will increase because of the illicit situation in the country. And this is in view of the 75% of illicit where cigarette consumption is sitting currently. This bill is designed to govern a compliant market that in reality barely exists. It will actually only impact around 25% of the market. That market is the legal tax-paying industry, while ignoring the rest of the 75% controlled by criminals. So with this in mind, our presentation, as I indicated at the beginning, will be in two parts. In the first part, I'll share some thoughts from a BAT point of view, how this bill could be improved to better achieve its objectives. Then my colleague Eddie will come in and demonstrate how evidence-based regulation can actually achieve the public health outcomes that we want. So first, let me just share a bit about BAT, about who we are. Globally, our company has adopted a new purpose, and this purpose is to create a better tomorrow by building a smokeless world. What does this mean? This means that as BAT, we are committed to reducing the health impact of our business. So we're here not to oppose regulation, but to ensure that we achieve evidence-based regulation that is also enforceable. So we fully support the efforts to regulate our industry and believe that all nicotine sales should be restricted to persons over the age of 18 years. But let me also clarify who is appearing here before you today. BAT South Africa today represents just 15% of the total cigarette market. We are a small compliant player in an industry that is now dominated by criminal syndicates. So we're doing this in the face of legislation that we believe will not achieve its intended objectives, but instead it will further accelerate illicit trade. So this is a huge concern for us that the bill doesn't sufficiently address. As I said, BAT believes that the fundamental flaw in this bill is that it will only affect 25% of the tobacco market. This impact will only be felt by a small compliant minority, while the illicit majority thrive. Every measure we believe that makes legal products less accessible or more expensive, we believe will drive more consumers towards the illicit market, where government has zero control over the contents, quality, as well as age restrictions. So we believe that the bill requires a level of enforcement that our country simply has not yet seen. Public health policy cannot succeed when most of the market operates outside the law. So let me put this in an economic perspective. The tax-compliant industry no longer dominates the market, but a sprawling illicit market does. I will show this by way of testimony. National Treasury in its numbers clearly demonstrate that in 2014, local manufacturers declared 22 billion cigarette sticks, and from this it generated 12.6 billion rands in tax revenue. Fast forward a decade later, after excise taxes had increased by a whopping 88%, declarations have collapsed to just 8 billion cigarette sticks in 2024. And this has also impacted revenue collection. Excise revenue collected by SARS from local manufacturers on cigarettes fell to 8.3 billion rands. The 2020 tobacco sales ban was a breaking point for the industry. Tax revenues crashed by almost half, from 14 billion to about 7.5 billion in a single year. And since then, legal sales have never recovered from this policy decision, which the High Court then declared unconstitutional. Meanwhile, total annual cigarette consumption actually increased from about 35 billion sticks to almost 37 billion stick cigarettes. The market has been turned upside down over the past decade. So, honorable members, in 2014, legal manufacturers supplied around 65% of the total cigarette market. Fast forward to today, criminals control over 75% of all consumption. This is a criminal takeover of the entire industry and a public health disaster. In practice, an illicit pack of 20s today sells for as little as 5 rand, and this was recently verified by a study conducted by Ipsos. The tax due to SARS, if I can demonstrate, the level of criminality, the tax due to SARS on every pack of 20 cigarettes is 26 rand 22 cents. Yet some brands consistently sell below this amount. Compliant business simply cannot compete against criminal empires selling these cheap tax evaded cigarettes. Public health, therefore, cannot be protected when the majority of purchased products ignore regulations. So the fundamental question, therefore, that I'm putting in front of this House, how can government implement additional tobacco control in a market that it does not, in fact, control? Public health policy cannot succeed where the majority of the market operates outside the law. Honorable members, I address you today with profound concern. Despite our extensive engagement at NEDLEC, mandated by this very committee, the bill that is before you remains deeply flawed. These failures, or the failures in this bill, will trigger a domino effect this bill risks failing in its public health mission. We believe that it will collapse the remaining legal industry, inflict devastating economic damage, and undermine good governance. Ultimately, it will hand the entire market to criminals on a platter. BAT's critique is not because we are opposed to regulation. It is because we have a clear-eyed view of South Africa's unique realities, the hard lessons learned from the past, policy failures in South Africa, as well as the concerns that I've raised in the foregoing presentation. The economic devastation the industry has already experienced at the hand of illicit players speaks for itself. So let me demonstrate again. Between 2020 and 2022, illicit tobacco cost our economy 22 billion rands in GDP and 36,000 jobs. Cumulatively, during that period, SARS lost 72 billion rand in taxes. We ourselves as BAT contribute over 8 billion rands annually in taxes to the fiscus, yet we're expected to compete against criminal syndicates that contribute nothing to the fiscus. Does it make sense to implement measures like plain packaging and display bans that will further advantage the illicit operators causing this very damage? Honorable members, I believe today we stand on fragile economic ground. If this bill is not significantly amended, this fragile ground will be shattered. But let me highlight 3 critical flaws in this bill that I believe that deserve your attention. These flaws, we believe, that will not only fail to reduce smoking, but may accelerate the constitutional challenge and economic crisis that we face today. Let me start with the first one, plain packaging. This is not just ineffective, it actively helps criminals. With this, illicit manufacturers will continue supplying branded packs that consumers recognize, making their brands even more appealing compared to unbranded legal packs. For counterfeiters, copying plain packaging will be extremely easy. The Department of Health points to developed countries like Australia as proof points that plain packaging works. But there is no evidence that these measures would work when around 75% of the market is already illicit and unregulated. The second concern that we have, retail display bans. This suffers from the same fatal flaw as plain packaging. It is another high enforcement proposal for a low enforcement market. It will place an impossible burden on informal traders and limit informed consumer choice, especially regarding newer smokeless alternatives that my colleague will touch on later in his talk. They push the market towards the cheapest visible option, and this is usually an illicit one. Third and finally, we believe that this bill may create a constitutional challenge. What do I mean by this? This will give the minister unlimited regulatory power while appointing his own oversight monitoring committee, which will also drive policy development. Where are the checks and balances in this? This monitoring committee is likely to be influenced by an anti-tobacco activist who will be granted power to oversee tobacco control, monitoring, and policy development. This will happen in conjunction with the minister having the power to issue regulations based on the monitoring committee's recommendations. For us, this creates a closed loop that bypasses Parliament entirely. The minister can simply rubber stamp policies his own appointees recommend. At NEDLEC, the business chamber of which we were part proposed turning this body into a genuine enforcement committee, but the Department of Health stated that enforcement is simply not its responsibility. This ambition for unchecked power isn't new. It mirrors the exact overreach that led to the disastrous and unconstitutional 2020 tobacco sales ban. The monitoring committee, we believe, is not about tobacco control. It is an assault on our democratic checks and balances, and we urge the committee to reclaim Parliament's constitutional authority. The specific sections that we are concerned with here are sections 4, 5, 6, 8, 9, and 15. These sections hand the minister a blank check to dictate every aspect of the industry. This includes the power to ban product categories like flavors or to decide who can sell products and where these products can be sold. This will effectively give one person the authority to shut down legal businesses and hand the entire market segments over to criminal syndicates. Honorable members, the power to rectify the bill rests with you. And here we propose 3 amendments that would achieve this. First, insists that government, including the Department of Health, measurably tackles illicit trade first with dedicated legislative tools. Secondly, remove counterproductive productions on plain packaging and retail display bans. And third, assert Parliament's authority by limiting excessive ministerial discretion and mandating parliamentary oversight of regulations. Honorable members, you have the chance to craft legislation that is constitutionally sound, economically rational, practically enforceable, and tailored to the needs of the country. I will now hand over to my colleague, Dr. Makotlo, who will show you how evidence-based regulations can actually deliver the smoking reduction that we all would like to see. Eddie, over to you.
Thank you, Johnny. Honorable Chairperson, members of the Portfolio Committee, thank you again for the invitation to engage with you today. I am Dr. Puti Edward Makotlo. I hold a PhD in infection and immunology from the University of Würzburg, that's in Germany. My postdoctoral fellowship at UCT focused on the challenge of TB and vaccinology, and I worked in the pharmaceutical industry before joining BAT in 2020. My colleague has explained why this bill was failing. Let me now show you what success can look like and why enforcement is still critical, even when discussing the new category products. As Johnny stated, BAT strongly supports the regulation of our industry, and I repeat that, Chair. BAT strongly supports the regulation of our industry, including the regulation of the new category or new nicotine products that are not covered in the current legislation. But how this bill treats newer smokeless products is critical, Chair. Combustible products like cigarettes burn tobacco. They produce smoke that contains thousands of harmful chemicals. Non-combustible products, which are sometimes called smokeless or electronic delivery systems, they do not burn tobacco, nor do they produce any smoke. Instead, they heat an e-liquid which creates a vapor. And this is fundamentally different from the smoke in terms of both the composition and the risk profile. The essence of this bill's approach is to regulate these products almost identical to combustibles, despite the substantial differences in the level of risk that they pose. This is a missed opportunity, Chair, to create meaningful incentives for smoking reduction. The bill before you is applying the same flawed template that has already failed for tobacco, a template that is powerless against the illicit market because it demands a level of enforcement our country has not yet seen. Let me be clear again, Chair. BAT urgently wants regulation, underage access prevention, and differentiation by risk. The current free-for-all allows for unscrupulous players to flood the market with very cheap, low-quality products and market them without restrictions. There are no controls over the marketing, the safety, and access, except for those that are some responsible actors that have imposed on themselves. This has allowed a serious problem of underage vaping to develop in South Africa. BAT supports regulation that will ensure product safety and underage access prevention. However, in attempting to deal with underage vaping, Chair, legislation may unintentionally prevent adult smokers from finding alternatives or reduce risk alternatives. This bill should substantially differentiate between combustibles and smokeless products, regulating them according to their different levels of risk. In this regard, Honorable Chair, I was encouraged to hear you suggest in a recent interview, I believe on the 22nd of July on ENCA, that the committee would make this important distinction within this bill. To be clear, BAT South Africa supports one piece of legislation, but differentiates between the different categories. The best choice, Chair, for any smoker is to quit. For adults who would otherwise continue smoking, the reduced risk products can be a better option. And I understand that you may be skeptical about what I'm saying to you today, Chair. But let me share independent evidence from globally recognized authorities who have concluded that these products are reduced risk when compared to smoking. In the US, the FDA has stated that tobacco products exist on a risk continuum and that non-combusted products or smokeless products generally pose a lower risk than cigarettes. Furthermore, the FDA has also approved several vapor products, stating that they are appropriate for the protection of public health. I repeat that, Chair. Appropriate for the protection of public health. On the other side, Chair, the UK Government Health Advisory Body has said that vaping poses a fraction of risk of smoking and that switching can deliver substantial health benefits for adult smokers. Both are government bodies that have no association with the tobacco industry. I could go on citing independent studies by respected global institutions that came to the same conclusions. But of course, you'll hear about other studies saying the opposite. This is why it's very important to consider what we scientists call as the hierarchy of evidence and the vetting that scientific research has been subjected to before it is published. One form of scientific literature provides the highest assurance, and that's the systematic review. A systematic review gathers all the evidence from multiple studies that meet very high standards, disregards studies that are weak in evidence or design, and draws conclusions based on the data from high-quality research. In this regard, Chairperson, the Cochrane database of systematic reviews is the leading database used to evaluate existing data for a wide range of health care issues. The Cochrane reviews looking at the effectiveness of specifically vaping products in smoking cessation were completed in 2014, 2016, 2020, 21, 22, and as recently as last year. I will refer back to the 2024, the recent one, which considered 88 studies with more than 27,000 participants. That's a staggering number, Chair. It concluded that there's a high certainty that nicotine-containing e-cigarettes increase quit rates compared to NRTs, and that is nicotine replacement therapy. This may address those concerns that dispute the effectiveness of vaping as an alternative to smoking. The impact of e-cigarettes on smoking prevalence is evident in many countries where vaping products have become widely available. You look at Ireland, France, Austria, and the UK. They have the highest rates of e-cigarette use and show the most significant declines in smoking prevalence. This real-world data directly challenges the gateway theory that some talk about. Instead of being a gateway into smoking, the evidence shows that these products are actually an off-ramp away from smoking for adult smokers. The UK annual population survey showed that only about 13% of adults smoke. It is noted that vaping devices have played a major role in the decrease of smoking prevalence in the country. Let's move outside of Europe. E-cigarettes are readily and relatively available in Canada and New Zealand too. Members, from 2012 to 2018, smoking prevalence in Canada and New Zealand was reduced by 4 and 3 percentage points, respectively. That is double the global average percentage points reduction over this period that I stated. Taken together, these different pieces of research using different methodologies show that e-cigarettes can be helpful for smokers who are unable to quit using other methods. And that is the essence, Chair, of tobacco harm reduction. It is for those other adults that would continue to smoke to completely switch to smokeless products and reduce the risk. Today, Sweden has the lowest lung cancer rates in the whole of the EU, largely because Sweden's smoking rates are the lowest in the EU. Adult smokers in Sweden have been transitioned to smokeless products such as oral tobacco products and oral nicotine products. Following Sweden, New Zealand is also on the verge of becoming smoke-free through the pragmatic approach of embracing vapor products as a better alternative for adult smokers, while still enforcing regulation to prevent underage access. We can achieve similar reductions in South Africa with evidence-based, enforceable legislation that protects underage consumers and informs adults at the same time. The key is that smokers need to be informed, and this requires large public educational campaigns similar to those that SA achieved in the HIV pandemic. This brings me back to the issue of underage vaping. There are other countries that have shown that regulation can reduce underage use whilst preserving adult access. What New Zealand did was tighten flavors and packaging, and the US on the other side have also strengthened their age verification and marketing controls. Both have followed their regulation with strict enforcement and have seen underage vaping rates decline. These approaches, Chair, merit consideration here. I've given examples of countries that embraced tobacco harm reduction, and through this approach have achieved remarkable reduction in smoking rates. By contrast, Chair, countries that make or take the more restrictive approaches have not made the same progress. And you may hear for South Africa to adopt the prescription-only model, for example, where vapes are only sold in pharmacies. And we must warn this committee that this has, it's a failed model and that it creates a public health disaster. Australia introduced the same model, severely restricted prescription-only model in 2021. And the current estimates indicate that there are about 1.4 million adult vapers in Australia. Of these, more than 90% are using illegal vapes. The smoking rate has also remained the same, and in 2021, New Zealand overtook Australia in terms of reducing the smoking rates, despite starting at a higher rate initially. This demonstrates the predictable failure of any models that demands the level of enforcement the state cannot provide. And it is a powerful cautionary tale for South Africa. Honorable members, controlling access is very critical, but a truly comprehensive framework also addresses the product itself. This is why the issue of product standards is also important. The responsible industry agrees that products with excessive nicotine levels or puff counts have no place in the market. That is why we belong to ICPA as well, which actively participated in the multi-year process with the SAPS to create national standards for these products. The Department of Health was invited to participate in this official collaborative process. It declined. Now the same bill seeks to grant the minister the power to become a standard setting body himself, bypassing the SAPS entirely. This is another example of a flawed governance, create unchecked power for a department that has already refused to engage in the proper established channels for creating sound evidence-based standards. At BAT, we support measures to ensure tobacco and nicotine products remain out of reach of individuals. And Chair, we propose 4 key principles that can guide you and the committee. prohibit underage sale and use, mandate age verification at the point of purchase or delivery, restrict flavor descriptors to those that are factual and not appealing to underage consumers, and last but not least, ensure a robust enforcement and sanctions. In conclusion, honorable members, South Africa stands at a crossroad. This is an incredible opportunity. We can choose the path of tobacco harm reduction and give adult smokers a real chance to try reduce risk alternatives as a way out of smoking while preventing underage access at the same time. Or we can miss that opportunity and face real serious consequences. Passing this bill in its current form risks failing to reduce smoking rates and actively creating a second parallel market for vaping and other smokeless products. This will enrich the same criminals that already control 75% of the traditional cigarettes trade. It will make our country less healthy and less safe, and critics who ignore the science will tell you that this is a necessary risk. But real-world evidence from countries that have embraced harm reduction say otherwise. You as the committee have the power to give millions of smokers a better choice without conceding to criminals. Enforce decisively, regulate proportionally, and keep the Parliament in charge of these major decisions. Thank you for your time and thank you for your consideration. We look forward to your questions. Thank you so much, Chair.
Thank you for your presentation. I now call upon our honorable members who would like to engage with the presentation. I will recognize hands as they come up on the platform. Honorable members, Honorable Dr. Klape, you are number 1. Number 2, just keep your numbers. Number 2, Honorable Clark. As I recognize them, Honorable 3, Honorable Balani. Is this a new member, Ms. Machalamba? Machalamba. Honorable Zungula, you are number 4. Number 5 is Honorable Shabangu.
Honorable.
Number 6, Honorable Sine. Number 7, Honorable Dr. Leroux. Number 8, Honorable Motubatsi. Right, now let me just see, my hand is blocked. Honorable, after Honorable Motubatsi is Honorable Chirampungose, number 9. Chirampungose. Anyone after that one?
Chairperson, my name is also up.
That is Honorable Mare.
Yes, Chairperson.
Honorable Mare, you'll be number 10. Any member I'm leaving behind. Ms. Machalamba, assist me there. There is a hand there. Who was that Vuyolwe to Balani who raised the hand and dropped it? Who was that one? Is a member of the public who wanted
I think he's a member of the public, Chair. I didn't see that.
Okay. Mr. Vuyolwe Tubalani, you come to these meetings to listen, and your participation is welcomed by listening. You don't engage. We will engage with the presenter, so we will remove you from the list. So let me revise, boss. There was the number 3. That hand came very soon. So number 1, Honorable Totali Klape, 2, Honorable Clark, 3, Honorable Zungula, 4, Honorable Shabangu, 5, Honorable Sine, 6, Honorable Totaleru, 7, Honorable Motubatse, 8, Honorable Chirampungose, and 9, Honorable Murray. Any other members left out? None. The team from PAT, you will answer after all the members have raised their questions to you. Thank you very much. Now you have a pen and paper, and then you listen to the members asking you. Thank you. Start, Honorable Dr. Letlape, and then members just note your number, come one after the other so they don't come in between. Thank you.
Thank you, Chair. I hope you can hear me.
Yes, we can hear and see you.
And that I'm visible. Thank you, and thanks for the presentation. My first question is, you speak about the monitoring committee vis-a-vis Parliament's role and the concern about Parliament's powers being usurped and being taken into the ministry's office or the department. What proposal do you have in terms of how Parliament can fulfill its role and how that should be configured? The second question is, what practical suggestions do you have about illicit market policing and curbing the illicit market and reversing the gains that they have had? The third question is, for product evaluation standards and market authorization, as the Americans call it, how would you suggest that be organized in South Africa? That's all for now, sir. Thank you, Chair.
Thank you, Chairperson. I hope you're able to hear my voice. I have very bad dose of bronchitis and I'm not well at all. The following questions are: what would BAT regard as a reasonable target to reduce smoking rates? Would it be less than 5% of the population? Second question: what are the details of your robust underage access prevention programs at point of sale, and how do you intend to enforce this? How do you measure the success of these programs of yours? Third question: what is your experience with law enforcement's policing of illicit trade, and what do you see as the biggest barriers to stopping illicit trade? 4, what specific changes would you make to the section of the bill highlighted in your presentation? And what is your opinion on the UK's ban of single-use vapes? What are the current standards for vaping products as set by the SABS, and how are they enforced, assuming this is voluntary, and how many other companies and organizations are part of this? And lastly, are you aware of why the Department of Health declined to participate in the SABS creating product standard for vaping products, and what would you consider realistic enforcement provisions? Thank you.
Thank you. Thank you for the presentation. Greetings to the chair, the colleagues, and everyone on the platform. On the question of the illicit trade, perhaps we need to move towards putting names and faces, because it's an argument that always pops up, the question of illicit trade, but without moving towards actually naming and shaming, I don't think would put enough pressure on law enforcement to actually curb the problem of illicit trade. So the first question is trying to understand, are the local producers involved in illicit trade, and what must be done by law enforcement to these producers when it comes to the reduction of illicit trade? And also from a scale point of view, what do you think is a scale of illicit trade as per the tobacco that is found, for example, being transported from neighboring countries to South Africa versus the quantities that are produced locally? because I think we need to try and understand where does most of the illicit or counterfeit illicit trade comes from, and also the scale of counterfeit products, because I think that's another element, because I think we need to pin it down to understand, is it tobacco coming in from other countries? Is it local producers who are under declaring? Or is it people in their back doors or in their makeshift factories that are producing counterfeit products? I think if you can give us more context into illicit trade and what needs to be done would assist a great deal. And what has been the impact on factory employment as a result of illicit trade over the 10-year period, which is from 2014 to 2024? And what has been the impact of illicit trade on tobacco farming, farming generally as an industry, and the jobs in the process? And I ask this in the context of what the Stats SA presented today, which shows an increase in unemployment, which is something, again, that is moving the country towards the cliff when it comes to the crisis of unemployment. And also, given that the Minister of Finance announced increased allocations to SARS over the medium term to fight illicit trade, what else do you suggest could be done to fight illicit trade problem as you have presented? And lastly, this question of actual tobacco products as well as the electronic products, I think it's something maybe would need more context and understanding on. Therefore, would you recognize the evolution of the nicotine market towards electronic products as a kind of just transition akin to what we have seen in the energy generation sector? There is Mr. Sfisos Kenjana, who makes this point in one of his writings, and he makes a really compelling comparison where he says that we need to understand the evolution as well in the nicotine market, just like in the energy industry. So what are the similarities that you think this committee should keep in mind when it comes to this new generation of products as some kind of a similar evolution as seen in the energy industry? I'll leave it there for now. Thank you.
Thank you, Chairperson. Good afternoon to yourself and all the members on the platform. This presentation, it had a lot of figures that were presented here. I just want to know from the presenters whether these were actually estimated projections or just speculations, and what method was used. Can they be verified, the figures that were presented here? Because there were a lot of them, and those figures, they do not have references. And then the second question, the presenter says the government cannot enforce the laws. In the same breath, says the government should adopt harm reduction with strict enforcement. Are you not contradicting yourself on that one? Secondly, that's the third one. This presentation, it makes references to the countries, some of them which are smaller than our country. There was no reference that was made with regard to South Africa. Why did the presenter not use South African data to show us of what is happening in South Africa, and prefer to use the data from other countries? I I'm not sure whether the presenter is aware of, ever heard of Uganda with 5% and Ethiopia with less than 5% smoking preference. Are you aware of the countries in Africa, including the ones that I've mentioned, that did not allow vapes and they are having smoking preference as far as lower than 5%? Example is that one of Ghana, Uganda, I mean, and Ethiopia that I've mentioned. Are you aware of those countries? Have you made some research around those countries? That those are African countries which did not allow vapes in their countries. And next one, if you place some of the products, in fact, main products that you manufacture as most dangerous, why are you still producing them? Why can't you use the same logic to stop producing these dangerous cigarettes, but you want to still keep selling this cigarette at the same time you are saying they are dangerous? Why are you still producing them? Are you not also condemning yourself as a business which is producing dangerous products? You also made a strong case in this presentation that that is relevant to South African revenue services. Have you maybe made this your presentation to SARS? How do you think a health bill will be able to stop illicit trade? Because you spoke a lot around that. When that mandate lies with the law enforcement agencies and SARS. Are you saying that because criminal elements operate illicit trade, people should not be protected against harm caused by this product, whether they are illicit or not? Because that is mainly the reason behind this bill, to protect the public against this harm caused by smoking. Chair, I will pause there. I will wait for the answers and from the presenters. Thank you for the opportunity.
Thank you very much, Chairperson, and thanks for the presentation. My first point, Chair, there are concerns from some people in this country that presentations like yours and others who are not from South Africa must not be accepted and must not be allowed to influence this piece of legislation. This country has been engaging in the processing of this bill or legislation as far back as 1996 and other years that followed thereafter. Is this the first time that you are in front of this committee in this way, or you've done this before? What do you say to this notion that your organization and others who are not from South Africa shouldn't have a say in processes like this? And then my second point, question, Chair. Sorry. My second question, you say you have a vision to build smokeless world, but you also said that not smoking at all is the best for public health. So why are you not aiming to build a tobacco-free world so that people can be safe from your products while kill so many people, both those who consume them and those who do not? While you, on slide 6, you call yourself a small player in the industry, Are you aware that based on results from the Global Adult Tobacco Survey, your brands are still the most popular brands smoked in South Africa? So what do you say about that particular point? And also on slide 7, you say the bill, when it comes to an act, will not be followed by about 25% of the market. Are you saying that, for example, when people are banned from smoking in indoor public spaces, people who smoke illicit cigarettes will not obey the law? Is that what you are saying? And can you see that what you are saying is incorrect? Because this bill is regulating the product and behavior of smoking and will not discriminate whether you are smoking licit or illicit products. And then you also said the legal industry is only responsible for 25% of the market share of in South Africa. Since you are saying your market has reduced by 75% in the recent years, have you declared any losses to this effect to really show what you are not benefiting from the so-called illegal market? Thank you, Chairperson.
Thank you, Chair. Thank you to the presenters, and for your for bringing your concerns to the committee. I'm aware that we have another 4 presentations, so I'm going to try and keep my questions short so that we can get to the answers. But the 2 questions I had, one was similar to what Dr. Leklape asked about in terms of the parliamentary oversight that you suggest, rather than having so much control through the minister. What aspects would you like Parliament to oversee? Of course, we don't have the executive function ability, but what aspects would you feel would be more appropriate to be done through Parliament rather than through the Minister's office? The second question was just around the harm reductions approach, and I appreciate the argument that you've made that we should be trying to encourage people to move away from smoking to less harmful alternatives, and ideally to not smoking at all. But from your understanding of the local context, I mean, I think that at the moment there is very little incentive for people to move from cigarettes to less harmful things like vaping, because the even single-use vapes are very expensive. And so, how would you propose that this can be encouraged if we were to approach it by a harm reduction approach rather than the complete banning approach? Thank you very much.
Thanks very much, Chair, and thanks for the presentation. First, you spend much of your time, I think, talking to illicit. Can you just simplify illicit for me? Because there are 2 aspects of illicit: it's trading and its production. And normally, people who bear the brand in terms of illicit would be the traders, and the traders themselves, as you'll observe, will be Africans. And in this case, they are the people who will suffer the most. How would you suggest that in terms of I think positively bringing Africans in particular into the scheme of things, what would be your contribution in making sure that they are brought into the mainstream economy? Secondly, you spoke about measurable targets. What would be your ideal measurable targets that you'd want this bill to address? Thirdly, what informs your view that the bill will not achieve its objectives? And what is your brief summary of understanding what the objectives of the bill is? And how do you address illicit trading? your role, your contribution. How do you see yourself as a role player, assisting government in making sure that illicit trading is kept? And remember, I spoke about the differentiation between illicit producers and illicit traders. As my colleague, Honorable Zungula, stated, let's name and shame these illicit traders, but in particular, I'm looking at illicit producers. Are there, I mean, it baffles me that in most cases we give examples of New Zealand, of Switzerland. Are we not taking pride of ourselves? And why have we not done any studies in respect of what positive results are there in Africa in making sure that we achieve the objectives of making sure that we deal with health hazards that are there? Why are we always having our studies coming from outside of Africa? The pride that we must have, and what role can you do to make sure that in future, South Africa in particular is categorized within the key role players that are leading, and it becomes an example of what the other role players in Western countries would refer to us as examples. Thanks very much. And also the last one, in terms of the alternatives, have you conducted any impact assessment studies that can inform the presentation that you have made to us? Thanks very much.
Thank you very much, Chairperson. Greetings to colleagues, to staff members, and everybody present. Thank you so much for your presentation. To the collective that did today's presentation. I think, Chairperson, a question I'm A1 because abanye sawabuza lama question from the EFF. And I'm just curious, Chairperson, about whether we aren't entertaining a digression to a large extent in this conversation on illegal or illicit cigarette industry and trade. And I'm saying this, Chairperson, because even the data that we have in relation to tobacco control policies that are enacted that have impacted illicit trade is in the context where those countries have weak border controls. And I'm stating this as a digression because then it wouldn't be something that is discussed in particular or in relation to this bill, right? It will be something that's entertained on a different platform that has to do with law enforcement, border control. You know, there would have to be a different engagement or process that is undertaken to deal with that crisis. I'm not saying it's not a crisis, it is a crisis. And these are legitimate concerns that are being raised. But are we not digressing from what this bill intends to do? And this is to the presenters. Are we not digressing from what this bill intends to do by making the focal point something that isn't even a part of the scope with which we're working with? Yes, it has an impact. Yes, it will be affected. But shouldn't that be then considered on a different platform, in a different process? And if so, then what is the proposition? Because even if we ask for proposals in relation to this bill, they will only make a conducive environment for trade for these businesses that are providing us with contributions in these hearings. As for instance, they will say that after the 2020 ban during COVID-19, they lost 75% of their sales, right? So now it becomes a sales conversation. It isn't no longer about public health, harm reduction, reducing reliance and dependence on tobacco products and stuff like that. It becomes about something else, which is a complete digression in totality from what this bill intends to do. And second to that, there is more than enough data and evidence. And I think we spoke about it in the previous hearing that we had. There is enough archived academic scientific evidence that bills of this form do have a positive impact in the long run. You know, it is not an immediate transition. It is not an immediate thing that happens overnight, but there are people that are being reached positively in order to get them off of tobacco reliance or addiction or use of tobacco. So wona umbuzo engizobuza like yini ukuthi perhaps maybe what else are we considering outside of the scope of this particular bill, but what are the propositions? Because I think leaving in this particular direction that doesn't do justice to what this bill had intended to do. So what are you proposing? Not in relation to amending the current bill per se, but what other processes are you proposing in dealing with illicit cigarettes, right? So is the proposal that we need to tighten our border control? And I think there's a previous speaker or a colleague that spoke about, are these issues that are happening domestically? Like, show us the way in which we should go or close the gaps, because leaving this bill in totality to prioritize sales, to have a paranoia as the backdrop of doing public good and prioritizing public health, I do not think it is the best route to go. Thank you so much, Chairperson.
Thank you, Chairperson. I would like to greet each and everyone, staff members, and also my colleagues and everyone that is on the platform today. Chairperson, I just want to find out from these presenters. A few years ago, we had this no smoking in certain areas, and you will have a smoking zone. Do they know how many people that particular bill, how many people did not smoke after that anymore? Yeah? Because this bill has been coming on a long way. And that time people were very paranoid, saying, yes, you can't go smoke at Spur anymore. You must go into a little room and smoke there. I just want to know, from that time, how many people are not smoking anymore? Was there any impact? And then I want to find out also, 2020 and 2021, during the COVID time, there was a ban on smoking. How many people, since the ban of smoking was during the COVID time, how many people stopped smoking and gave up smoking completely? And then also about the illicit trade, I just need to understand is that everyone comes on the platform, speak about illicit trade. And 2020, it was on the highest. It was like everything there was coming from the illicit trade. By now, 2025, we should have names now. We shouldn't have company names and people's names of who are the people that is in charge of this illicit trade, because we are in 2025 and we are still talking about faceless people that doesn't have a name and a face. So I just need to understand is that the tobacco companies are all coming in saying that less harm reduction, go for the vape. The vape is more expensive than ordinary cigarettes. What is the other alternative? Because you are saying we want to have a smoke-free country. But in the meantime, then you're also saying, go for a lesser harmful product. And that is a concern for me. So what are they really saying? Thank you, Chairperson.
Thank you very much. The last ones from myself is just to augment what some of my colleagues have asked. But to start with, I just noticed for your record that of your 30 minutes presentation, 17 minutes of your time was spent on illicit trade discussion. And I just wanted to highlight that, and maybe coming in closer to what Honorable Chirwampung was just raising. During 2010, the borders were closed. 2020, because of the COVID, the borders were closed and bans were there on cigarettes. But we had a huge surge of, as you are putting it, of illicit tobacco. Now, when borders are closed, you then must admit, and probably you may not be one of them as BAT, that there were people who were doing legal sales by day. So, of course, those ones were then banned during the time of COVID, but they were doing illicit by night. And the illicit is within the country. So do not look outside the borders and say, no, when we talk about illicit, just concentrate on closing the borders. Otherwise, all of us as South Africans are very clean and good. We don't do illicit. So there's no illicit. So there are people who are actually trading in tobacco, and they are illicit by night, and they are actually legal by day. And you should also be, we are not in the industry, but we know that those things are happening. I don't know whether you are not aware of. So I would be circumspect to look into somebody else's product and give it the name that this is flawed. It will never achieve what, I mean, it's not scientific to say something you will never achieve. Rather, you could be much more diplomatic in terms of what you then turn off other people when you have your starting point is that this thing is never going to achieve this, that, and the other. And in your presentation, that was almost 17 minutes on the illicit. You actually are saying you must tackle the illicit first. Now, which countries in the world that have tackled illicit first before they put on and strengthen their tobacco laws? Which country in the world has done that? Because I've just been reading countries that are actually tight on this. And this issue of illicit is a globalization that is happening all over the world. It's not unique to South Africa, but why then do you say South Africa must tackle illicit first before then they go and tighten up its law? Its laws on tobacco. You actually are saying if you don't do that, we are likely to actually get much more, and plain packaging, retail display, you will actually put more. There are countries in the world that have actually done this plain packaging, but you don't say by so doing they had to wait and tackle their illicit only until they have tackled that. They must not actually put on the straw. So I think you actually have certain strict expectations of South Africa, which has never happened anywhere in the world, to say, deal with this first. Only when you come back and report to us illicit trade has been tackled in the country, then let's talk and sit and discuss what we do to tobacco. Why do you think that is the right approach to do? Thank you. Come with your responses.
Thank you, Honorable Chair, and thanks to the honorable members for their questions. It was quite a lot. We'll try and bucket them into categories because the way I've noted them, I note that a lot of them come into categories, but I'll start maybe, Chair, from the one that you raised and work my way back up. So, Chair, for me, my understanding of what government is intending to achieve with this bill is to try to regulate the entire industry, not certain parts of it. So if parts of it have been non-compliant for years, it means there is a serious problem there. It means only certain law-abiding industries will comply with this tobacco control bill. And for me, that I believe that this honorable house should be very concerned about that therefore there's no equal playing field. That means only us that are compliant with these regulations, which we have been, to another question that was asked earlier on, for the past century that we've been in this country. So BAT is a local company. Our parent company is a global company, but BAT is a South African company. So that is the point from which we start. And if we look at that and take total industry, then I pivot to the initial question that was raised by Dr. Litlape and many other honorable members around what is it that you would like to see in terms of your target. This is really not up to me, but I do believe that the Ministry of Health, being an advent believer in the WHO, they have set the target of 5% to say this is what best practice looks like. So if you don't have to take our word for it, this is a WHO standard. And we believe some of the examples that we have shown are those countries that have actually followed a path deliberately to target that 5% target. Then let me bucket the questions again around illicit, because as you say, we spent 17 minutes around this, because it is a true concern to us, because if you have 75% of the market, and this is a question that relates also to a challenge that was posed to us to say, where do we get these numbers? Fortunately for us, we've been running research studies for the past decade or so, where we measure consistently the market trends in terms of our industry, because we started observing this trend for as long as 2010, if not earlier, of the rise in products that do not comply with tax. And if I can just clarify for the members of the committee, for our understanding what illicit is. Illicit are products that do not pay excise. So any product that do not pay excise is illicit. But from the context of this bill, a product that also does not comply with the current act, which this bill seeks to repeal, that is a concern as well. And in our part, we have been asked the question, what have you done to raise this concern? We've actually, in 2020 in particular, written to the Ministry of Health where we've seen infractions of manufacturers that were not compliant and raised our concerns. To date, we're still waiting for that response. Now, let me tackle the questions that were raised in particular to elicit to say that what is it that you are asking for to be done in this regard? We have been very clear in our request because we do not have the mandate or power to do any enforcement. That relies with the law enforcement authorities. And besides the Revenue Authority having the mandate for this, it takes a whole of government approach, as the commissioner himself mentioned in 2021, to tackle this problem. It is beyond just the capability of SARS to do that. So we have been specific in terms of what we ask as short to medium term solutions, where we have specifically requested for the placement of customs officers in all the manufacturing factories, including ours. That is number one. Number two, we have said that any player that is found to be foul of the law must have their license withdrawn, including us if we're found to be acting outside the law. And thirdly, we have said because implementing these regulations, or rather the Customs and Excise Act, is so difficult for an entity that has limited capacity, put a minimum retail price, which would say to any law enforcement officer, whether it's a police, whether it's a metro officer, if you find a product selling below this price, seize that product. And by the way, we have also in this regard relied on research by independent institutions like the Research and on the Economics of Excisable Products at the University of Cape Town, which by no means is a pro-tobacco research institution. Very, very, very independent in that regard. So these are the proposals that we put on the table to say, actually, it is doable in the short to medium term, while the Revenue Authority, with the 7.5 billion that has been allocated to it, seeks more permanent solutions like AI, as the commissioner said. Now, there was another question of saying that who are these nameless people? Who are these faceless people that are actually perpetrators of this scourge? In the research that we have conducted, we are on wave 7 of that now by Ipsos. Ipsos actually goes into market and try to find the cheapest product that doesn't comply with the minimum collectible test. And on the basis of that, it mentions all the manufacturers. We are open to sharing the studies, that results of the studies with you, so that you can be able for yourself. And this is also information available to the revenue authorities to say that these are the people. Actually, one of the honorable members already touched on this. The majority of these manufacturers who produce 21 billion of these cigarette sticks in the country are right here, local manufacturers within the borders of South Africa. Only 6 billion of illicit comes across the border from Zimbabwe in the main. So we are open to sharing those research fundings with you. We also conduct studies through Oxford Economics. We also conduct studies through FTI. All these studies we put out we can share with you, honorable members, so that it's not an assumption or a thumbs up or estimates, as one honorable member was questioning, because maybe it's an oversight on our part that we haven't shared the references to this. And on top of that, we can actually facilitate these institutions to come and present in front of this house. So we can invite Oxford or Ipsos to come and present in front of you. And then the other question that was asked of us was around what really can Parliament do to tackle the issue of ministerial overreach, that your powers go up to a certain point. Our view is that we would like to see that Parliament oversees and approves all regulation that is in the public interest or that impacts, the way in which different players in the industry operate. So this is our proposal on the table, that we are just quite concerned if there is no transparency in how we are regulated. As we said over and over in our presentations, that we welcome regulation, and this is urgent. We would like to see regulations being implemented. And I think I've just bucketed, and there was a question also on the impact in the industry. How much in terms of jobs that were lost. An Oxford economic study that we commissioned as well demonstrated that from 2019 to 2021, the industry, to 2022 rather, the industry lost about, by this I mean the value chain in its entirety, from what we call a leaf right up to the cigarette. So the leaf are the farmers who grow, onto the processors, then onto us, the manufacturers and the retailers. We lost about 28,000 jobs in that tobacco value chain. So I think I'm not sure how much time we have left, but there were also pertinent questions that were also related to these alternative products that I would request my colleague Eddie to come on and try and tackle some of those here.
Thank you, Johnny. Honorable members, thank you for your questions. Certainly warranted. So we do really appreciate your feedback and these particular questions. I would like to start with the standards issue. The vapor standards were published, I believe, last year around September, October. Yes, the product standards for vapor were multi-stakeholder engagement, including many entities and many healthcare and stakeholders that participated in that process. It's a technical document which goes into toxicological assessments. It goes into the nicotine limits. It goes into the packaging. It also addresses very well the age restrictions as well. As far as I know, the DOH did not participate in this process, but I do know that they were invited multiple times during that process. They just didn't show up. What I and what we believe as BAT is that, yes, these standards are voluntary and they serve as a guide for many manufacturers into how to manufacture these products. However, enforcement is still an issue underlying all this. In South Africa, we do have what we call the NRCS, which is the National Regulator for Compulsory Specification, and it's mandated to actually make any standards that is deemed necessary mandatory too. So I think if you're thinking practically, that would make sense to make those standards mandatory. And that is just the recommendation. When it comes to several examples that we gave with regards to best practice by many countries out there. Yes, the bill currently, there is studies that are included, South African studies, but there's also outside studies. In any public health intervention, recommendations and so on, we do look outside. Even the current bill, there is references of outside studies as well, and this is the best practice in scientific spheres. So I hope that addresses that part, that these figures that we have do come. These are not BAT figures, by the way. These are from governmental institutions in those countries that we just extrapolated to this, and we can provide references for that. This is a bill like this. When you embark on an intervention to achieve a public health outcome, a specific outcome, you need to start with a target, right? The target for the WHO, as we say, is 5%. And our ambition, as mentioned, as part of our transition as well, is looking towards that. And that's why we provide these examples of those countries that are moving towards that. I did mention between 2012 and 2018, the New Zealand, they achieved that within a short space of time, but that's because they accepted and embraced harm reduction as part of the public health strategy. There was another question regarding the approach of harm reduction and what sort of communication should, I mean, if you look in the UK, for example, a couple of years ago, when they embarked on this journey, they actually put out an incentive scheme, a campaign and an incentive scheme where they gave away and incentivized those smokers, adult smokers who were who they wanted to quit, and gave them incentives into vapes. If you look at Sweden, what they do is a risk proportionate tax regime where these products excise is taxed less than what your highest, which is combustible cigarettes, tax is. What I also wanted to touch on is how do we achieve this practically? And the first thing that we can borrow is some of these countries, what they did is produce or introduce a licensing scheme or a licensing program where every vape store or any of these retailers have licenses to operate. And that means there are then, in that licensing, they have to be compliant. And there's hefty fines. I mean, if you look at New Zealand, the fine is quite hectic, up to 10,000 New Zealand dollars if you're found, for example, non-compliant and selling to a minor. In Sweden, there's also the same example. There's hefty fines, and that's what practically I would recommend. If you look at the US, for example, through under what they call the PACT Act, you know, there is a reporting line for non-compliance. So what are we doing as BAT? And I'm referring back to Honorable Clark for her question. As BAT, we strictly enforce age gating at all our vape or retail outlets. And anyone who looks under the age of 25 must show the valid ID and prove that they are under 18. We also, as mentioned, that we are part of the PASA, public awareness campaigns, and they conduct mystery shopper for our stores as well. As mentioned, the key principles here is to prohibit underage sales and use, mandate age verification. Those are very simple, practical terms that you can implement. There was a question in terms of harm reduction as a whole. This is a journey, and it's not something you achieve within a split second. If you look into the other energy sectors, for example, if you look into the automobile industry, moving away from combustible engines now into renewable energy or into electric engines. You look at coal companies or coal manufacturing, coal burning companies. They've also moved into renewable energies with all the windmills and so on. And that takes time. As we mentioned, as BAT, it is a transition, and we are very vocal into what those targets are over time. I believe that there was a question about the impact assessment.
You have 2 minutes to wrap up your responses. Okay.
Thank you, Chair. Thank you, Chair. In terms of the impact assessment, there hasn't been an impact assessment, but there has been a study that was done. I believe I saw one of the presenters presenting it, that was looking at the number of lives saved if the policies had to take into account harm reduction as a public health strategy. And it clearly shows the number of lives over 300,000 lives that could be saved over the next years. And the CS should have been done for this, Chair. It should have been done as part of the process by the DOH, but we are not sure why it hasn't been done to date.
And Chair, if I may come in with the remaining minute, we realize we're under pressure with many of your questions, and there has been a great deal of interest, especially in what the actual market looks like. So at some point, maybe when the chairperson leads the committee on an oversight visit, we extend an invitation to take you through a market visit and also just show you for yourself so that you see how the market looks like. We thank you for your time.
Yeah, thank you very much. If you do have, because as a committee, we are still going to be discussing further the input that we are receiving. If there are any questions that you did not really expand well, please forward that to Ms. Machalamba, your responses on that. It will actually populate our sort of work that you still have to consider. Thank you very much.
Thank you.
Yeah. Ms. Machalamba, can you assist?
Thank you, Chair.
Yes. As the team from BAT is logging off, can you request that, by the way, BAT are not being chased away. You can remain if you so wish for the next presentation. We are now going to get a presentation by the Independent Community Pharmacy Association. I hope that they are given the sharing rights already. If you know them, if you do, can they then be given the sharing rights and they start? And we would want to advise them that ICPA, you have 30 minutes to make your presentation. You may not be able to exceed that one. You will then have to listen to the honorable members making inputs and asking questions. Then you come back to clarify us on those questions. So at 16:31, your 30 minutes starts now, so that at a minute after 5, you'll stop. Thank you.
Chair, can I just on a point of order?
Yes.
Can I just get a sense? I see that we have 5 presentations scheduled for today. Up to now, this first presentation has taken us an hour and a half. And so if we continue at an hour and a half per presentation, it's going to take us 7.5 hours. We are then scheduled to finish probably after 10 o'clock tonight. Could I request that we perhaps limit our questions to 2 minutes per member? Otherwise, I just think that we are not going to be able to finish this before it is very late. And I'm just concerned that at the moment we're scheduling about an hour per presentation, but with the questions and the responses, it's taking us nearly an hour and a half per time. So I would just ask if that might be a possibility. Thank you, Chair.
That will assist greatly. I was writing to Ms. Machalamba to say the members asked questions. It took 20 minutes. All of us combined, we took 20 minutes to ask questions. Because other members were asking 6 or 7 or 8. And therefore, we then gave the person another 30 minutes to reply, which is actually what we are actually saying. If members could assist that they take their best 3, 2.5 or 3. Because if you ask 8 questions, and if all of us were to ask 8 questions and we are 10 here, so it means there's 80 questions to be answered. Unless we do it differently. We'll take that as a request, Honorable Leroux. We may not prescribe, but we request members to observe that. Okay, thank you very much. Your now time.
Thank you, Chair.
You will finish at
Chair, my hand is up on this issue as well.
Yes.
Chair, I was going to propose maybe in future we may need to discuss the best way of engaging to manage time, but really get to the substance of the discussions, because I think, as you might have observed,
no, let's do that, Honorable Zungula. You will write that in our chat group, then let's engage with that type of a scenario in our chat group. We will not have time to discuss it here on the platform now. There's a presenter to come in. Let's chat about it in our chat group. Thank you very much. start, sir.
Right. Thank you, Chair. Thank you so much. Thank you for the opportunity to address this honorable committee, that is the Portfolio Committee on Health. Let me start first by greeting you, Honorable Chair, Dr. Domo, honorable members of the committee, my colleagues that I'm coming with today, and everyone that is on this platform this afternoon. Greetings to all of you. My name is Khabo Komate, and I'm the Deputy Chair at ICPA, which is the Independent Community Pharmacy Association. Chair, I'm not going to waste any time, and I want to introduce to the committee this afternoon our CEO, Ms. Jackie Maimin, who will be taking us through the submission that we have shared with you as the Portfolio Committee. Once again, let me take this opportunity, Chair, to thank you for the opportunity to participate in shaping this bill, which is a very key piece of our legislation. Without any further ado, Chair, let me welcome our CEO, Jackie. Over to you, Madam CEO. Please proceed.
Thank you very much, and greetings to everybody. I'm going to go straight in because we're going to try and catch up some time. Chair, just an introduction. So ICPA is a registered non-profit company acting in the interests of independent pharmacy owners. We represent 1,200 independently owned pharmacies, 3,500 pharmacists, and about 20,000 support healthcare personnel. Our membership represents arguably the largest pool of pharmaceutical professions in South Africa, with a substantial reach into both urban and rural South Africa. And our key imperative, Chair, is the right to a quality healthcare service for every citizen. So if we have a look, where are our pharmacies? You'll see there's a snapshot. We are in all the major cities and towns. We're in suburbs, peri-urban, and deep rural areas. We operate long hours, often 7 days a week. We offer home delivery services, and every one of our pharmacist owners is invested in the communities they serve. Very often, we are the first port of call for primary healthcare services. And I can assure you, Chair, that as healthcare professionals, and I'm sure many of you on the committee, we have all been affected or know somebody who's been affected by tobacco. So advocates for health and well-being.
Sorry, on your country slide, why do you have different colors for the pharmacists?
Different provinces, Chair.
Yes, but these are the same. Doesn't matter whether it is okay. The colors are okay.
Yes, the colors just represent the different provinces, Chair.
Okay.
So as healthcare professionals, we collectively support the regulation of ENDS and electronic delivery systems in South Africa. It's long overdue, and we applaud the legislation makers. Our reasons are rooted in public health concerns and the potential impact of ENDS and EDS on individuals, communities, and in particular, Chair, the youth. So as pharmacists and any healthcare professional, our role is to save lives. And one premature death will have been avoided with every 2 smokers that a pharmacist or any healthcare professional persuades and helps to stop smoking. So if we have a look at what we're going to talk about today, Chair, and as I've already outlined, we support the call for this regulation. We're going to have a look at the health risks and safety concerns, youth and adolescent use, addiction and smoking cessation, product quality and standards, secondhand vapor and public health, marketing and advertising, data collection and research, and lastly, global health standards. So the health risks and safety concerns, and Chair, these are all referenced. So if we have a look at the systematic reviews, new evidence indicates that e-cigarette users may have higher incidences of certain cancers compared to non-smokers and even traditional cigarette smokers. There's also an article in the Cardiac Heart 2021 that shows that evidence in humans, there's evidence in humans that supports the notion that while electronic cigarettes may be less harmful than traditional cigarettes, they are certainly not harmless. Then the last reference that I have here is an article by Peruzzi et al. And this is about electronic vaping cigarettes, or EVCs, they refer to them as. And these have impacted adversely on blood pressure management, caused tachycardia, and worsened arterial stiffness. EVCs use has been associated with an increased risk of adverse clinical events, including atrial fibrillation and myocardial infarction. The American Lung Association put forward some research around e-cigarette or vaping product use associated lung injury, which is termed EVALI. So EVALI is a serious lung condition caused by vaping. It is characterized by inflammation and damage to the lungs. It can be severe and life-threatening, with more than 50% of patients with EVALI requiring admission to the ICU. It was initially identified back in 2019 and is linked to the use of e-cigarettes and vaping products. And in particular, certain additives are linked to EVALI, for instance, vitamin E acetate. As of February 2020, which was the latest info I could find, more than 2,800 patients were admitted to hospital with EVALI, and unfortunately, 68 of those succumbed to the illness. So, Chair, if we're looking at the health risks and safety concerns, whilst they are often promoted as safer alternatives to traditional cigarettes, research on the long-term health effects of ENDS is still developing. And I put this advert in here, lest we forget. Remember, the 1950s promoted smoking for young mothers. So we support legislation to ensure that these products are safe and regulated to protect the health of users and non-users. So, Chair, at the moment, vaping is unregulated, and it, in my opinion, is aimed at the youth with lovely colors, with all the flavors like ice cream and bubble gum. Chair, we really need to regulate this market. Bubblegum, mango, cotton candy, these aren't flavors, Chair, they are bait. We need to protect our children. Chair, unfortunately, I could only find data from the UK, and that's, I believe, is because there is no regulation in South Africa at the moment. And that's why later in my presentation, I'm going to show you how we can start getting information for South Africa. But these slides here, Chair, show the trends in vaping and smoking following the rise of disposable e-cigarettes. It's a cross-sectional study in England between 2016 and 2023. So, Chair, it was in June 2021 that disposable vaping was introduced. And what I'd like to show you is the age group of 18 to 24, which is the green, Chair. These are new smokers, Chair. And if you have a look here, look at the sharp increase in the youth. So the idea that people who are already smoking will stop smoking and start using vaping is not supported by the evidence, well, certainly not the evidence from the UK. We look at addiction and smoking cessation. Many will argue that ENDS can be used as smoking cessation tools for adult smokers. And we don't deny that. While there is some evidence that ENDS can help some smokers quit, there are several evidence-based cessation medicines available which are currently regulated by SAHPRA. And some of the evidence that was brought by the previous speaker, which showed that ENDS are more effective than, for instance, nicotine replacement therapy, must remember that when we talk about smoking cessation, we can't match one product against another product. Smoking cessation involves behavior change therapy, support, and medicine. And so if you had to take an ENDS and verse it against a proper smoking cessation program delivered one-on-one by a healthcare professional, I doubt that there would be significant evidence to show that the electronic devices are stronger. So evidence shows that many change from one form of addiction to another. And this is why we are so concerned about the youth that are entering the market via inhaled vaping. And again, I'd like to point you to the same evidence, which is the prevalence of current inhaled nicotine use, smoking and vaping in the UK. Chair, here we can have a look at the graph B, which shows 25 to 44-year-olds. And once again, we can see the introduction of disposable vapes in June 2021. And what we see here is the smoking, which is the sort of the orange triangles. Smoking continues to decline in the UK. If we look at inhaled nicotine, it started to increase after the introduction of disposable vapes. And if we look at vaping as a total, look at the sharp increase. Chair, if we then look at the 45-year-olds, which are the ones we really want to get off smoking cigarettes, we can see that it is pretty stagnant and there hasn't been much change at all. And it was interesting, the reference to Australia, where nicotine vaping is on prescription only from your pharmacy. But Australia has a smoking rate of below 8%. It is almost at the WHO recommended 5%, which means that they do not have smoking prevalence in the country. So I don't think it was a very good country to refer to. The one I want to bring your attention to, Chair, is graph A. These are the 18 to 24-year-olds that are coming into the market. Now, we do know in South Africa that unfortunately, the youth as young as 15 are smoking. So if we look at this graph from the UK, you can see here the introduction of disposable vapes. Once again, it's inhaled nicotine. Look at the sharp increase of inhaled nicotine. Smoking is going down. It's a trend that started long before the disposable vapes. But Chair, have a look at the exponential growth in vaping in the youth. And this is what we are seriously concerned about. These are new people being introduced to nicotine addiction, which will plague them for the rest of their lives. We all know that nicotine is one of the hardest addictions to break. It is even harder than crack. So, product quality and standards. By implementing regulations, healthcare professionals can ensure that these products meet specific quality and safety standards that are associated with medicines. We know that the EVALI that happened in 2018, 2019 was because of vitamin E acetate. We need to know exactly what are in these vaping liquids. We can't have lay people compounding solutions or mixtures that can cause so much havoc. And this includes regulating, as I say, all the ingredients, the manufacturing processing, the labeling, the packaging to reduce the risk of contaminants and dangerous substances in the products. Nicotine is already listed in the medicine schedules in the Medicines and Related Substances Act. And I'm going to take you to that slide now. So here is the excerpt straight off LexisNexis, which lists nicotine in a number of schedules, from Schedule 0, where it is in products, for instance, nicotine gum or lozenges, where there's not more than 4 milligrams per piece of gum. You can see Schedule 1, we start talking about the patches, and in Schedule 2, anything that contains more than 4 milligrams per dose. So, Chair, it's already there. Nicotine in lower doses is a medicine, and nicotine in higher doses is a poison and needs to be regulated. So vaping liquid controls, it is our opinion that this be handed over to somebody like SAHPRA to investigate. But what we do know is that the nicotine content of cigarettes varies from about 6 milligrams to 28 milligrams per cigarette. But we can say on average, a single cigarette contains about 10 milligrams of nicotine. Research shows that a tobacco smoker inhales about 1.1 to 1.8 milligrams of nicotine per cigarette. Now, an electronic nicotine delivery system delivers vapor. When the user inhales, it activates the vapor. So the majority of the vapor is inhaled. It doesn't heat the vapor when you're not actually inhaling. So the strength of nicotine in vaping fluids must be regulated. I've seen fluids with 18 milligrams per mil, 30 milligrams per mil. We even have evidence that some of the non-nicotine solutions contain nicotine. This needs to be regulated, at least, Chair, to allow no more available nicotine than in a packet of cigarettes, which is 36 milligrams if you look at a pack of cigarettes. So we believe then that the maximum strength should be 3 milligrams per mil with a maximum volume of 36 mils. This also talks to child and pet safety. So the fatal dose of nicotine for a child can vary depending on factors such as child's age, weight, overall health, and individual sensitivity to nicotine. You can just Google poisonings by nicotine and plenty of them come up. Nicotine is a highly toxic substance, and even small amounts can be dangerous, especially for children and animals. So one of the first things we would highly recommend is that child safety caps be put onto any of these vaping liquid for sale. So as little as 10 milligram or 1 cigarette equivalent of nicotine can be fatal to a baby. We support the call from the WHO to enforce child-resistant packaging for vaping liquids to reduce the risk of accidental nicotine poisoning among children. And the product must also contain the wording, "Keep out of reach of children and pets." Secondhand vapor and public health. Although ends produce fewer harmful chemicals, and I'm in agreement with the previous speaker that the cigarette smoke, about 95% of the harm comes from the combustion, and it's the hydrocarbons, the volatile hydrocarbons and carbon monoxide that is the problem. But they are not entirely risk-free, and share any risk is too much risk. So we support regulations that address secondhand exposure to exhaled ends, vapors to protect non-users from potential health hazards. And this includes banning their use at workplaces and public spaces, exactly the same as we have for cigarettes. If we look at marketing and advertising, Chair, we need to do something. Have a look at these vapes. Unicorn. Watermelon mint ice with children's cartoons pictures on them, and even toys available on Take-A-Lot. My first vape for a 6-month-old baby so that he can vape with dad. It's unacceptable, Chair. ENDS and EDS marketing have been criticized for appealing to young people and non-smokers through various channels, including social media. And we advocate for strict regulations that prohibit any advertising or display of ends, plus a restriction on attractive packaging, flavors, and alluring devices. Data collection and research. Proper regulation can facilitate data collection here in South Africa on ends usage, health effects, and trends. And this information is vital for evidence-based policy making and informed public health interventions, and forms a part of pharmacovigilance via SAHPRA. Global health standards, and I'm coming to the end of my presentation, Chair. Many countries and reputable health information sources, such as the WHO, are recommending considering or implementing ENDS regulation to safeguard public health. Supporting such regulations aligns South Africa with global health efforts and allows for cooperation and learning from other nations' experiences. Chair, as I end off, just like to show you the World No Tobacco Day this year in 2025. It was about bright products and dark intentions of the tobacco industry and unmasking the appeal The World No Tobacco Day estimates that 37 million children aged 13 to 15 years worldwide use tobacco. And in many of these countries, the rate of e-cigarette use of young people exceeds that of adults. This was supported by that evidence I showed from the UK. Flavors are found in many nicotine and tobacco products, and there are now about 16,000 unique flavors. Flavors are often cited as the #1 reason for initiation of nicotine and tobacco product use. Marketing content promoting e-cigarettes, nicotine pouches, and heated tobacco products has been viewed more than 3.4 billion times on social media platforms. Chair, ICPA supported the World No Tobacco Day this year, and we put forward many posters showing same addiction, different disguise. Our campaign was really highlighting the dangers of vaping. And talking about highlighters, have a look at what some of these vaping devices look like. Now, as a teacher looking at junior school, opening a pencil box, it's very easy to see when a child is smoking cigarettes, but those look like highlighters. And how does a teacher know when their students are vaping, when these devices come in all these shapes and sizes? Chair, nicotine is highly addictive, and our youth are starting to vape. The companies are not selling fun, they are selling addiction. So our recommendations, Chair, with all due respect, are to ban all flavors. Tobacco products must taste like tobacco. Regulate content, strength, and volume. There needs to be plain packaging with health warnings and child-proof locks on the vaping liquids. Ban all promotion, sponsorships, marketing. Ban use in public spaces and around children in particular. Thank you very much, Chair.
Okay, honorable members, thank you very much for this input. I will now recognize your hands to engage. I see hands are coming up already. Honorable Shabangu, you are #1. Honorable Clark, #2. Honorable Sine, #3. Honorable Chirompungose, 4. Honorable Dr. Leroux, #5. Honorable Mutubatse, #6. Honorable Zungula, #7. Honorable Toheleklape, #8. And Honorable Mshongo, you are #9. Any other one I'm missing out? Okay, honorable members, if you could actually assist to limit your questions so that you can all be able to participate and partake for 3 more other presentations to be made. Follow your numbers, honorable members. I won't call you again. 1, Shabangu, 2, Clark, 3, Sine, 4, Chirompungose, 5, Leroux, 6, Mutubase, 7, Zungula, 8, Itape, and 9, Mhlongo. Thank you. In that order, one after the other.
Thank you, Chairperson, and thank you to the presenter. I'm glad that she acknowledged and appreciated the fact that the vaping products are not harmless. And she even explained more other conditions that are caused by these products, especially this vaping with the damage they cause on the alveoli. I'm glad he mentioned that and is acknowledging that extensively so. The measurements that are mentioned on the nicotine in of the cigarette, your 1.1 milligram, the average content. Do you have any information that you can compare on the nicotine content in this e-cigarette? Those are the only questions I have. Chairperson, I appreciate the presentation. Thank you.
Honorable Clerk.
Thank you, Chairperson. According to the research you have read, and I'm assuming you read research on both sides, how effective are vapes and other ends in helping people to quit smoking cigarettes? We've had a lot of presentations citing the Cochrane report that claims that nicotine e-cigarettes are more effective for smoking cessation than traditional nicotine replacement therapies. But your presentation seems to rebut this. Have you read or looked at the Cochrane report, and what is your view on this? There have also been the claim in a number of other presentations that it is not the nicotine in tobacco that is harmful, but the tar. What is your view on this? In the research, you cited that electronic vaping cigarettes impact adversely on blood pressure management, causes tachycardia, worsens arterial stiffness, and is associated with an increased risk of adverse clinical events, including arterial fibrillation and myocardial infarction. Which of the chemicals in vapes causes? Can these adverse effects be directly linked to nicotine? Thank you.
Thank you, Chairperson. The less harm claims of vapes made by certain presenters who have come here, it's a bit confusing. I believe pharmacists are experts in pharmacology. I'm convinced that less harm does not mean harmless. What is your take on this view? And number two, what will it take for pharmacists to be able to recommend vapes for those who are still smoking but want to quit? Thanks, Chair.
Thank you, Chairperson. It's Chiram Pungose from EFF. I just wanted to appreciate the presenter's emphasis on the issue of vapes and giving it a human feel and a human perspective in relation to young people, right? I do agree that they're not selling them. It's not just a sale of a product, but it's a sale of addiction. And it's prevalent even in the small things, like these vapes are advertised in accordance to fruit flavors, you know, presenting it as a healthier alternative or a healthy alternative. And it's dangerous to present such a thing with that kind of a marketing tool, you know, including colors and all of that. So I just wanted to appreciate the presenter's presentation, especially because even with vaping, there are long-term issues, health issues, you know, like memory loss, impulse control for young people. It alters brain development, especially in teens. We're really appreciating the presentation done by the presenter on this particular aspect and sentiment on young people. That is all from me, Chairperson. I thank you.
Thank you, Chairperson. Thank you very much to the presenter, and thank you for raising your concerns around the tobacco. I mean, on the vaping in particular. I think my colleague has asked about that sort of very thorough Cochrane review on the benefits of using vaping as an alternative to other nicotine products. So it seems to be about double as effective to help people stop. And I hear your points about the fact that that there's a whole group of young people that all of us would not want to expose to it. And at the moment, in the South African context, there's no doubt that there's a massive concern about the unregulated selling of vapes for children under 18. So I completely hear that point. I think that the 2 points for me is just, I think that it's important to also in terms of I forgot the short term of those lung issues. I think that those are is perhaps a slightly alarming thing. That's something that happened a long time ago. We know exactly why it happened because of the additive, and I agree with you that should never be put into vapes again. But that certainly isn't something that has recurred. And so my two questions really are I'm interested to hear from you as a pharmacy what your interest is, and I think that a cynical person would say, well, vaping might harm your business model of selling nicotine suppressants. So I just wanted to get your perspective on that. The second thing is just around the harms reduction perspectives that we've heard from many other people. What is your perspective on, if we look at other countries that have used stricter and less strict approaches to electronic methods, it seems like the countries that have pushed people towards the less harmful. We know that there's a certain group of people in every country that will be addicted and will be driven towards nicotine addiction, and to push them towards less harmful, like nicotine or pouches. What is your perspective on that? And what is the best way one of the studies talks about nearly 300,000 people's lives being saved if we approach to harm reduction rather than a banning or a complete equivalence approach. And so if you could just give feedback on that, I'd appreciate that very much. Thank you.
Well, thanks very much, Chair, and appreciate the presentation as presented. I just want to get a take on the online sales, because I think you emphasized on the regulations. What do you think should be the intervention on the online sales, because that will be open to even underage and people who are not prescribed, like you made the presentation, the suggestion in your presentation. Secondly, what is the view of the association about the Cochrane systematic reviews? Does it think that these are misguided, seeing that no reference is made to them? And the committee has just been told that systematic reviews are at the top of the scientific review hierarchy. Secondly, does the organization consider the report publicly published by the UK Royal College on Physicians in 2016, which concluded that smoke for the nicotine and dye from the tar to be misguided in its conclusion that the process of combusting tobacco is where the danger lies in the nicotine intake, and that in fact delivering nicotine without combustion could have significant gains for the public health. Thanks, Chairperson.
Thanks, Chairperson. Thanks, Chairperson.
Okay, you can proceed, ma'am.
We appreciate the presentation, but I'm having some little concerns because the pharmacist has just indicated that there are higher incident rates of CA that are reported with the use of these smoking types. And again, we're also challenged when we see the rate of EVALI incidents that has been reported. It is worse here in South Africa because most of our youth are engaged or involved in drugs and the drug usage. When we are looking at all these challenges, how are we going to be, whether we will be able to combat or to end the drug interaction, or we will be able to help them with the after effects? Is that going to be feasible or easy for us to assist the youth? Because it is clear that most of these are going to affect our youth. I thank you.
Honorable Mhlongo, I appreciate you are coming in. You jumped the queue. Now, after Mutubasa, it was supposed to be Honorable Zungula, who will then be followed by Honorable Letlape, and there's another hand now of Honorable Mare. Let's do that in that order. Honorable Zungula, followed by Letlape, and then Mare last. Thank you.
Thank you, Chair. Let me shoot straight to the question. to the presenter. The issue when it comes to equating vaping with smoking, would you not perhaps agree that that could raise protecting cigarettes as a primary form of nicotine delivery and inadvertently depriving South Africans of potential exit routes from smoking? Because any attempt to equate the two products in the public imagination may amount to really sabotaging the South African public health policies. The second question, does the Ivali example perhaps not give us a cause to pause about the potential harms that could result should the vaping market experience illicit trade and counterfeiting? The third question is regarding the general principle as espoused in the draft or in the bill that speaks about alignment to the constitutional values and principles. So the values and principles of the Constitution, which gave certain rights to citizens, is perhaps having a policy that deprives the autonomy of the individual to make a decision on his own. Do you not think perhaps that autonomy must be respected? And the last question, from your perspective, what kills when it comes to the discussion we're having? Is it the tar? Is it smoking? Is it nicotine? Can you pin it down to say whether it is in a vape, it is in a cigarette, it is in a snuff or anything, but what is the danger exactly? So that we're able to pin it down to say this is the cause or the cause of the death, regardless of the method of delivery or the type of product, but this is the killer that perhaps the policy or the bill or the act needs to address. Thank you.
Chair, is it me?
Yes, Dr. Letlap, it's you now.
Yeah, I can only count up to 3, Chair. My first question, thanks for the presentation. The first issue is, are you aware that Ivali had nothing to do with nicotine vaping? It was about cannabis vaping, and as you rightly said, acetate to improve the yield, where because of poor regulation and in the black market, the cannabis was enhanced with acetate. So the Ivali and the stats that you put are true, but they had nothing to do with nicotine. And that retraction has been made publicly, but those that published the information about Ivali. Second, the question is the cardiovascular effects on hypertension and the things that you said that are correct. Are they being compared to smoking or being compared to fresh air? Because the key issue is about reference to smoking and whether there's more harm or less harm. You've rightfully said that there's a challenge and a problem with youth uptake that we're all aware of. But in the UK, they've shown that despite the youth uptake, which they take seriously, they've had the biggest decline of smoking and nicotine use than they've ever had in the last 5 years. Smoking cessation. There are many studies that show that there are higher quit rates with vaping than with nicotine replacement therapy and psychotherapy alone, as shown by the many, many studies that were reviewed in the Cochrane review. And nicotine harms adults. Now, I'm fully in agreement about the challenges with youth uptake that we need to work on. But should we deny adult smokers less harmful products? And I was just quite intrigued by the notion of any risk. As a pharmacist, maybe you can enlighten me. As a doctor, we prescribe drugs. And all drugs will have inserts that will tell you about the associated risks of using the drugs, something that is commonly referred to as side effects. Are you suggesting that with this any risk new approach, we shouldn't be recommending drugs to patients? Because none of them are without risks. So I just need to know that with this new outlook of the community pharmacists about any risk, how does that apply to the prescription drugs that we give every day? Lastly, in your recommendations, you had lots of recommendations to ban this, ban that, ban that. Is it the considered opinion of your group that bans work? And secondly, nicotine is very bitter. And it has been shown that adult smokers will switch because of some of the flavors that are not attractive to children. So when we ban all flavors, are we promoting cigarettes and discouraging less harmful alternatives to cigarettes? So I'm just concerned, and I am for control, and I am for control of dosages, but I become extremely concerned about advocating bans, because in my humble experience, bans drive issues underground. They don't provide solutions long term. Thank you, Chair.
Honorable Mare.
Thank you so much, Chairperson. I want to apologize. I had to go to the bathroom, and when I came back, you already took the hands. Chairperson, the only thing that I want to know is that what do the presenter have in place if she say that the nicotine within the vapes must be maintained? There must be a certain amount of that is required. And I also want to say that it is nice to hear someone is saying that these vapes with the children faces, the Mickey Mouse and the what, it's very dangerous, because it's the first time that I hear that someone is talking about that. But the way the presenter was presenting is like she's more against the vape and more against and more for the cigarettes. So like the previous speakers were also saying, is that if you don't want to have the smoking, you can go to the vape because you want to reduce your smoking. I just want to know what do they just suggest, what must be the replacement, and how are they going to implement this replacement? Because number one is when people are smoking, it's like you say, it is a addiction. And the addiction is something that you can't get. My husband always used to say, I want to leave the cigarettes, but the cigarettes don't want to leave me. Something like that. So I just want to know is that how are they going to measure these things and how are they going to put it in place? Because like the previous speaker was saying, banning is not an option, because then we hear, like we heard with the previous speaker, about the counterfeit goods and and all these things that is happening in South Africa already. How are we going to control that? Because at the very moment we're sitting with a crisis where illicit goods are making a lot of money, and by banning things, it's going to create a bigger market of illicit goods. But I want to say thank you for the way she presented it about the children and these vapes and the characters of the children that was shown on these things that is online. Because you can see even younger children that is on the way to school are smoking these vapes. I am just worried because I saw the other day a group of people sitting together, mother and father, all of them are chatting. The child took the vape and put it in his mouth. What is the concern about that? Thank you, Chairperson.
Hello, just one for me. Thank you very much for the information on please, committee, be vigilant on the issues of vapes with flavors, baby faces, and all sorts of things. I think that was a very good sort of point to make. But you didn't say anything about nicotine pouches. Maybe that was not your area of focus. But somebody says that one is limited. Of course, there's still harm, but there's limited harm as compared to what you have raised here. But you seem to be saying, if I were to really wanting to quit, but I am unable to quit completely today, would you still not say go to this one which is less harmful? Yes, there is still harm. Well, what would be your advice there? Because we are actually saying the bill is probably having a strong view on those who have not started. But for me, who has already started, well, how do you assist me with your pharmacology knowledge? Thank you very much, ma'am. Thanks.
Thank you very much, Chair and
Try
honourable
don't go
members.
beyond the 22.6. 22.6, I'll stop you there at about 25.6. Thanks.
Perfect, Chair. Thank you very much. So, Chair, firstly, we are not advocating the total ban at all. And I'm sorry if my presentation brought that forward. We were talking about banning promotion, sponsorships, marketing, the same way we've done with cigarettes. Also banning the use in public spaces and around children. We are not in favor of banning vapes. We cannot ban vapes. It'll just go underground if you tried to. So from the perspective of harm reduction, absolutely. To take somebody from smoking cigarettes and get them onto a vape is most certainly harm reduction. Now, cigarettes, there are three things in cigarettes. It's nicotine, which is the addictive component. There are the tars or volatile hydrocarbons, which really cause the devastation to the lungs that are linked to the cancers. And they are the serious part of cigarettes. And then, of course, there is also the carbon monoxide, which is the product of the combustion. And the carbon monoxide, which is what makes our blood sticky and increases the risks of stroke and such adverse events following smoking. So certainly going from smoking, an established smoker, harm reduction is the way to go, absolutely. If you've got somebody who on a Fagerstrom dependency test scores highly, is smoking 40 cigarettes a day, wakes up first thing in the morning and smokes cigarettes, the likelihood of getting them off cigarettes or off nicotine is highly unlikely. And we know that getting that nicotine addiction is more difficult to treat than any of the other addictions. As I say, I even mentioned crack and cocaine. So harm reduction for people that are on cigarettes, we absolutely support. And somebody asked the question, what would it take for a pharmacist to recommend a vape? Well, that's easy. Pharmacists, firstly, we need evidence. There is evidence that shows that switching to vaping reduces harm. But what we would need in addition is we would need some sort of control, Chair. So at the moment, these liquids are compounded in vape stores that are just mushrooming everywhere. As a pharmacist, I have no idea what is in there. What is that flavorant? What are the colors? What is in there? There's no list. You're not going to get a pharmacist to recommend anything unless we know exactly what is in there. And any healthcare professional with a conscience, how can you recommend something when you don't even know what is in there? Where is the quality assessment? How do we know how many milligrams of nicotine is in there? And how do we know that there isn't vitamin E acetate? And I agree that a lot of the EVALI was contributed to cannabis, but if you go and have a look at those studies, they can't say it was only cannabis. It was vaping, and it's the vaping that we have got a problem with, not necessarily the nicotine. It's the inhaling those vaping solutions into your lungs. Now, the majority of vaping solutions is propylene glycol. We do not know the long-term effects of propylene glycol on lungs. We don't know what's going to happen to the cilia that line the lungs. We do know what the hydrocarbons do to them and the destruction that it causes within the lung. The research at this stage is limited. And so we really do not know. And that's why I used the adverts from the 1950s, where we were actively promoting cigarettes. I mean, Marlboro was the GP's choice. Well, thankfully, we only have paracetamol as the GP's choice now. And I know there was a question around medicines and how can we recommend medicines that have ADRs. Medicines are to treat a condition. There's a risk benefit that is looked at. When you're smoking or vaping, what is the benefit? There is only a benefit if you're going from something really harmful to slightly less harmful. To initiate vaping, there is no benefit, absolutely none. And that was Honorable Chlapet. To say that we shouldn't recommend any medicines, I presume that you were just pulling my leg, because obviously medicines are recommended to treat conditions. I wouldn't even recommend paracetamol unless you had a headache. Chair, so just to make it clear, we are not opposed to vaping. We think it needs to be regulated. We need to know what are in those fluids. We need to know that somebody is checking the exact amount of nicotine that is in there. The inhaled flavors, if there are going to be flavors, are they harmful? Have they been checked? We know that, for instance, tartrazine colors in medicines are now limited. We need to know, is there alcohol in there? Isn't there alcohol in there? And that's what as pharmacists we would need to be able to recommend vaping. And we really would like to have vapes available to us. Currently, our legislator, our statutory council, Pharmacy Council, has banned the sale of any ENDS or even EDS in pharmacies. And that's because of the lack of regulation. So, Chair, if we go and have a look at some of the questions, somebody also asked about the nicotine content and whether we are able to compare that with that's in the vapes. Well, that's the very issue that we're talking about here. We have no idea. And I cited the fact that there is research out there where people have gone and tested non-nicotine vaping solutions only to discover that they are full of nicotine. So I indicated that a cigarette has about 10 milligrams of nicotine, and we inhale about 1.1 to 1.8 milligrams. There are nicotine solutions out there, anything from a few milligrams, like 3 to 5 milligrams per mil, right up to 18 milligrams, 30 milligrams. And this is being compounded by a layperson in a store. Chair, it horrifies me. And that's why we as pharmacists cannot recommend them at the moment. And I'm hoping that this piece of legislation will reinforce harm reduction and then give access to healthcare professionals to be able to, in all good conscience, recommend harm reduction to those who wish to stop smoking cigarettes. Quite a few questions were around the systematic reviews, which talk to the fact that there is some evidence from the Cochrane reviews that, in fact, recommending this harm reduction or vaping was a better, well, that more people were successfully stopped smoking. And yes, absolutely, we have looked at that. And in fact, the systematic review indicated that referring somebody onto vaping actually increased the number of people that stopped smoking by 4 per 100. And that is significant, Chair, and we absolutely recognize that. And that's why we very much would like vaping to be available, but where we can control it and know exactly how much nicotine is in there, and that as a healthcare professional, we are not recommending something that is going to later on down the track, we discover that could have caused harm. So that was around the systematic review. We do recognize that, and there certainly is a place for vaping, especially in smoking cessation. I think what we as ICPA are very worried about are new people starting vaping. We cannot allow vaping to be this cool thing that the youth will get hooked on. There was a question around whether nicotine is the problem. So nicotine in young brains is a problem, absolutely. It affects brain development, and nicotine should never be recommended to anybody under 18. Over 18, yes, it's your constitutional right to be able to choose, and we do not recommend taking that away at all. Nicotine is not the problem in terms of long-term adverse effects. The one thing the nicotine does is it causes addiction. And you become addicted to the product, which means you can sell more and more. The problem with addiction is that you need more and more of the product to get the same effect. And so that's the wonderful thing about nicotine, is that once somebody starts, they can't stop. And you've got somebody for life. And that's what we really need to move away from. So since tobacco control has been introduced in South Africa, we have seen a significant decline in smoking, and we want to continue to see that, Chair. We do not now want a graph that is on the upward trajectory, especially with the youth, with more new people being hooked on nicotine. Now, in terms of smoking, we know the dangers, and especially here, I'm in Cape Town, in the Western Cape, we've got a real smoking problem, up to 30%, much higher than anywhere else in the country. And of course, we also have TB. And nicotine, where I said to you that there aren't any adverse effects, it is the nicotine that does tend to cause adverse or drug-drug interactions. And in fact, as pharmacists, when we stop people smoking, we need to sometimes adjust certain medications, such as psychoactive medicines. Chair, I hope that I'm covering everything. I just want to have a quick look here if there's anything. Online sales, how do we control that? That is beyond my scope. I'm just a pharmacist. I think that is something that the likes of SAPRA and Parliament could look at, but we definitely need to do something there. How do we assist the youth? I think the one way to assist the youth is not to allow vaping to have become this cool pastime. There is tremendous peer support, peer pressure to be cool, to have the latest vape, to have something that you can hide from the teacher. And some of the youth are starting because of the flavors. And then they use liquids that they think don't have nicotine in them. And then they do have nicotine in them. And before they know it, they are stuck in that trap. In a country where we have so much poverty and so many societal issues, we can't afford households that have to buy cigarettes or make a choice between baby formula and a cigarette. So, Chair, I really ask the Portfolio Committee here to consider these issues. I was asked the question by Honourable Zungula whether vaping, whether we are promoting smoking and vaping versus smoking. We never promote smoking. And as harm reduction, we would promote vaping if we knew there were controlled solutions. It is not our intention, and I hope I didn't come across to say that we are totally against vaping and therefore support smoking. If people can't stop smoking, then we would advocate for harm reduction, but we don't want any new users. I was asked a question around EVALI and the potential harms in the illicit trade. I'm afraid I don't know much about the illicit trade.
Your last 2 minutes.
Last 2 minutes, Chair. I'm going to open it up maybe to Mr. Komapi or Mr. Botha, if there's anything that they think that I have missed. I'm done, Chair.
Thank you, Jackie.
I think you have done justice there to the questions. Perhaps in a form of addition, the question of comparing the vapes with the harmfulness of vapes, which is considered to be less than traditional tobacco, comparing it with medicines which have got side effects. I think if vapes can also go through SAPRA and be regulated through that, so that we can be sure how much of the nicotine content is in there, and we will then be able to accept vaping perhaps in pharmacies. And we indeed support our regulatory body, the SAPC, in banning that in pharmacies. But I want to just say, Chair, the bill that we have on our table is really balanced. As far as I'm concerned, it is not banning totally, but it must regulate to protect the young ones that may inadvertently enter this market unknowingly. We want to protect and reduce the damage on the adults, but we are seeing that it is the young ones that are now entering the market, and we need to close that door and close it permanently, Chair. Let me pause there. Thank you very much.
Thank you very much. Your time has just been up. Thank you very much for your cooperation and your support to us. We appreciate this greatly. And we will look into your presentation and enrich our discussion as a committee. You are now released, but you can stay so long for the next two presentations of professors. Professor Konsantinos, Farsalinos. Professors are used to giving a 1 hour lecture in universities. You will obviously not have a lecture here of an hour. It will be 30 minutes. Your slides are very pictorial. Please take it that we have looked into your slides and presentation, and therefore it highlights on that, and you will have 30 minutes starting from now. So at 6:05, your time will be over. Thank you very much. Welcome. Present to the portfolio committee, and then thereafter the portfolio committee will engage with yourself. Thank you. Professor Konsantinos.
Yes, that's my first name. It's an honor for me to present here in front of the committee. It's the second time I'm presenting, and thank you very much for giving me this opportunity. First of all, I will start with my declaration. I do not consult, work or have any other association with any industry, tobacco, e-cigarette, pharma, or whatever else. And all the views presented here are based on my own experience with more than 110 scientific publications in the international literature on tobacco harm reduction and more than 80 presentations in international conferences. Now, one of the main principles for public health policies is to be realistic and science-driven, of course, and should always consider not only the intended benefits, because every initiative on any kind of regulation has, of course, benefits to consider, but also the unintended potential harms of any decision. So that's very, very crucial. Of course, and I will declare it from the beginning, I fully support the need to regulate all tobacco and non-tobacco nicotine products, all of them. But in order to do that, you need to apply, in my opinion, a very common policy strategy, which is risk proportionality. That means the lower the risk, the less restrictive the regulations. The higher the risk, the more restrictive the regulations. Yep. Am I sharing my presentation? I think I am not. So let me share my presentation, and sorry for this. Yeah. So I think now you can see it. I hope.
Yeah, we can.
Yeah, okay. So my declaration, as I said, is that I do not work for anyone in the field, in the commercial activity of nicotine, and my views are my own. As I said, risk proportionality, that's very important, and I think you are very familiar with that because it's a common principle for any type of policy. Now, globally, we have 1.1 billion smokers, and that is after 60 years of extensive knowledge about the harms caused by smoking. In South Africa, we have 20 to 25%, depending on the source, of adults who smoke, almost 35,000 premature deaths every year due to smoking, and of course, a heavy economic burden for the country from productivity loss, healthcare expenditure, and of course, life years lost. And a main reason why we still have a lot of smokers is that we don't have very effective smoking cessation tools, unfortunately. So, for example, this is a study using the best smoking cessation medication that we have, which is varenicline. And the success rate at 1 year, up to 52 weeks, was 19.2% in people who already had a heart attack due to smoking. So if we want to make a conclusion, a general conclusion about the smoking cessation efficacy of the tools that we have, the medical, pharmaceutical tools, in the best case scenario, it's 20-25% at 1 year. With nicotine replacement therapies, it's far less, it's 7% at 1 year. And that's why we need harm reduction. And what is the principle of harm reduction for tobacco? It's the same as with any other harm reduction strategy. In this case, it's to provide nicotine to people who cannot or do not want to quit with currently approved methods or by themselves, using a less harmful source of nicotine. Because unfortunately, tobacco is the most harmful product to obtain nicotine, but also the most effective product in delivering nicotine. And that's what we need to overcome. That's what every smoker needs to overcome. And harm reduction for tobacco has been promoted as a valid approach for many, many years. First of all, it is based on the quote from 1976 in British Medical Journal by the father of tobacco harm reduction, Professor Michael Russell, a psychiatrist, a late Professor Michael Russell, who wrote in 1976 that people smoke for nicotine but die from the tar, which means from the combustion products. Tar is a collection of compounds produced by combustion. And in 1991, so more than 30 years ago, he wrote that the role of non-combustible nicotine products, and I remind you that at that time, e-cigarettes were not invented, heated tobacco products were not invented, nicotine pouches were not invented. We only had snus at that time. He suggested that the role of these products are to serve as long-term alternatives to tobacco. And he said that that is the only way that we can eliminate smoking in the future. That was the views 30 years ago of Professor Michael Russell. And why is tobacco harm reduction a necessity? First, because still today, many people, millions, die prematurely. 8 million all over the world. 8 million people die prematurely due to smoking. Quitting smoking, as I said, is extremely difficult. So tobacco harm reduction, this needs to be clarified, is an additional supplementary strategy to all the other measures. It's an addition to the medications. It's an addition to psychotherapy and psychological support. It's an additional tool for those people, and unfortunately they are the majority, who fail to quit by themselves or with the help of healthcare professionals. And these are the whole array of harm reduction products that we have now, today, globally: electronic cigarettes, smokeless tobacco, snus, heated tobacco products, nicotine pouches, which is a non-tobacco oral nicotine product, and of course, nicotine replacement therapies, which can also be used for the long term. So the questions that you need to address in order to make your decisions on policies are the following. Are harm reduction products really less harmful than smoking? Do they help people quit smoking? What about uptake by non-smokers and youth? And will tobacco harm reduction products disappear if we decide to ban or heavily restrict them? These are the common questions, in my opinion, that should drive the answers to these questions, should drive your policy decisions. So it is important to start accepting harm reduction. It is important to differentiate nicotine effects from smoke effects. And there is globally a lot of misperceptions and misunderstandings about the effects of nicotine, even among experts. We have today long-term epidemiological evidence from the use of snus, which has been traditionally used for decades in Scandinavia, mostly but not exclusively in Sweden. And these studies have shown that nicotine is not a carcinogen, and that's why the International Agency for Research on Cancer, which is a WHO organization, does not include and does not list nicotine as a carcinogen. And nicotine has minimal, if any, effects in the initiation and propagation of atherosclerosis. One of the major misconceptions, even among cardiologists, and I'm a cardiologist myself, is that nicotine causes hypertension, causes heart attacks, causes so many heart conditions. No, we have extensive epidemiological evidence in the form of meta-analysis, which is the highest quality evidence, that, for example, nicotine does not increase the risk of heart attacks. Not just nicotine. Snus, which is a tobacco product containing nicotine, does not increase the risk for heart attacks. And we have meta-analysis on that. And Sweden has been a country that should be studied and should be used as a paradigm by everyone else. Why? Sweden has the same nicotine use rate as the rest of the European Union. Based on the 2020 Eurobarometer, this is the same, there is no statistical significance. However, smoking in Sweden is by far the lowest than the rest of the European Union, and today, in 2025, it is less than 5%, so Sweden is the only country in the world which is classified as a smoke-free country. The difference in Sweden, despite having the same nicotine use rate, is the source of nicotine. They obtain nicotine from snus and from nicotine pouches, mostly, but also electronic cigarettes, all other alternative to smoking nicotine products, but not from smoking tobacco cigarettes, contrary to what's happening in the rest of the European Union. And being a smoke-free country with the same nicotine use rate as everyone else, Sweden has, especially men, because snus is more popular in men, has by far the lowest rates of tobacco-related lung cancer deaths, deaths from other cancers, and deaths from cardiovascular disease than any other European Union country. In some cases, compared to the median in the rest of the EU, it is 2 to 3 times lower death rate from these causes. So you understand that we have a real-world case of a country where the use of alternative to smoking nicotine products has been a tradition. It is quite high, the nicotine use rate is the same as Europe, but the effects on health are very much different compared to the rest of the EU. And as for nicotine, I will remind you that both the US FDA and the UK equivalent, which is the MHRA, support and have approved the long-term use of pharmaceutical, of course, nicotine products as a smoking substitute. According to the UK MHRA, even lifelong use is much preferable if a smoker needs to still continue to use these products in order to quit smoking and to stay away from smoking, not to relapse. And the reason for this is very simple. With tobacco cigarettes, we have combustion. The tip of the tobacco cigarette, when a smoker takes a puff, is being heated at 800 degrees Celsius. And these products of combustion are what the user, the smoker, then inhales. It doesn't matter that the smoke then, the temperature of the smoke goes down by the time it reaches the mouth. These products have already been produced during this extreme heating process, and they will not revert back to the original content of the cured tobacco leaf. In contrast, with e-cigarettes, we have basically evaporation of a liquid that does not contain any tobacco. The temperature of evaporation is happening at 180 to 250 degrees Celsius, and there is no combustion, no production of carbon monoxide, no production of combustion products, so no smoke is produced by these products. When we look at heated tobacco products, it's a not same but similar story. They do contain tobacco, the same tobacco that is used in cigarettes. However, instead of burning the tobacco, they use heating elements, either penetrating the tobacco or around the tobacco stick, where they heat the tobacco. The temperatures of heating are between 250 to 350 degrees, depending on the product. Again, they don't have any combustion. For nicotine pouches, they contain pharmaceutical-grade nicotine impregnated in usually cellulose or other plant fibers. They do contain flavorings from the food industry. They may contain some pH buffers, but they do not involve any heating. They do not emit anything. The user does not inhale anything. So the safety risk profile of nicotine pouches is, I must say, identical, not even almost, but identical to a pharmaceutical nicotine replacement therapy product. Concerning safety, there are so many studies today. We have more than 10, 15 years of extensive experience. For example, large reduction in toxic emissions. This is one of my studies, completely independent. We compared tobacco cigarette, electronic cigarette, and the heated tobacco product. It is important to identify the level of risk reduction, not just to say that toxins are reduced. In this case, formaldehyde, we found a 90 to 99% reduction in formaldehyde emissions compared to tobacco cigarettes. This is a tremendous reduction, and we see that in many other toxins. In some cases, particularly with electronic cigarettes, we see 100% reduction, complete elimination of things like polycyclic aromatic hydrocarbons, which are toxins. 100% reduction in elimination, so basically for nitrosamines. The cancer potency, this is a study, completely independent study from 2017, which examined the content of the cigarette smoke and the content of the aerosol of heated tobacco products in the electronic cigarettes. The cancer potency based on the chemical analysis of the aerosol was reduced in heated tobacco products by 97.6% and in electronic cigarettes by 99.6%. So I will fully agree with you. It's harm reduction, it's not harm elimination. But as you can see, it is very close to harm elimination. The level of risk of reduction in exposure and in relevant risk is tremendous. It's not just a slight reduction. And concerning heart disease, and I heard some honorable members of the committee who expressed serious concerns about heart disease. I decided not to present my own meta-analysis, which was published a couple of months ago, where we found that e-cigarette use was associated with the same level of risk reduction in myocardial infarction and heart attacks as we have seen in people who quit smoking without using any alternatives. But there are serious limitations in the studies that we analyzed, because it was not our own studies, it was analysis of all the literature available in this field. So I decided to present to you what is, in my opinion, I think it's an objective opinion, the most important study ever published for electronic cigarettes. It was published in October 2024 in South Korea, in the European Heart Journal, one of the biggest cardiovascular journals in the world, completely independent, funded by the university, not by any commercial entity. What they did was follow up 18,000 smokers who developed a stenosis in the coronary artery and had to do a percutaneous coronary intervention, so basically angioplasty, stent placement, and so on. And they were all smokers. And they were followed up for 3 to 5 years. They wanted to see how those people who continue to smoke fare compared to quitters without using anything compared to users of electronic cigarettes. What they found is that switching from smoking to e-cigarettes, even without complete quitting of smoking, had identical, not similar, identical benefits as complete cessation without the use of any alternatives. And I will show you the graph which shows the proportion of patients who developed a second episode of heart disease during follow-up. The lowest number, which is 10.8%, was the group of people who were using electronic cigarettes. They had the lowest numerical rate of a second event, even compared to those who had completely quit smoking. And these people who switched to e-cigarettes, 55% quit smoking completely. The rest, 45% of them, had reduced but not completely quit smoking. So you understand that the meta-analysis of this study, isolating only to e-cigarette users who had completely quit smoking, would have been even more beneficial for e-cigarettes. Another very worrying problem that we face everywhere is that, unfortunately, 50% of these people, so out of 18,000 people, 9,000 kept smoking after developing smoking-related heart disease. And this is the problem, and this is the reason why we need tobacco harm reduction. Why? Because 50% of people after being diagnosed with a heart attack and 50% of people after being diagnosed with cancer cannot quit smoking. It's an astonishing number. And the risk for these people is even higher compared to someone who has not developed any disease and is still smoking. Smoking cessation. There is irrefutable evidence about e-cigarettes being more effective than nicotine replacement therapies. The latest randomized control study was published from Australia 1 month ago in low socioeconomic group smokers, which is, if I understand well, very relevant also to South Africa, because not only South Africa, everywhere, it is the lower socioeconomic group that has the highest smoking rate. They compared e-cigarettes with nicotine replacement therapies. Electronic cigarettes were 3 times more effective in smoking cessation than nicotine replacement therapies. A study in Australia where e-cigarettes are effectively banned and where, as you understand, the perceptions of the population concerning these products is pretty bad and pretty negative. There is some evolving data on heated tobacco products and pouches. We don't have the level of evidence that we have on e-cigarettes. We must be realistic. Sorry, let me stop my camera for a while. Excuse me for this. So data are still evolving, but we have the data from Sweden. You know, Sweden is a smoke-free country, and Sweden would have never been a smoke-free country without the use of snus. So moving forward, gateway to smoking. Yes, it has been a problem of youth uptake, but we cannot discuss about gateway to smoking, and the reason is very simple. Look at the data from the CDC, the Center for Disease Control of the US. During the period of growing popularity of e-cigarettes, smoking has been eliminated among US adolescents from 15.8% in 2011, when e-cigarettes started to be marketed, to 1.7% today. 1.7% is almost a 10-fold reduction. It's basically almost zero. But vaping, which was initially, yes, quite popular. Of course, I will agree. But you see that it's also going down, and it's going down heavily. And today, after the peak that they had in 2019, today it's 5.9%. So much, much better. But of course, there is use. And I will explain later what you can expect. Flavors. A big question about kids and flavors. Yes, I can make a separate presentation because I have written also studies myself. I can make a separate presentation about the importance of flavors for smoking cessation. There are so many studies showing that non-tobacco flavors multiply the efficacy of e-cigarettes in smoking cessation among adult smokers. I need to be very, very, very important, to stress that. For adolescents, everyone discusses about flavors. Okay, I will show you one of the latest surveys from the CDC in the US, which asked adolescents what was the reason that they initiated cigarette use among e-cigarette users, high school and middle school kids. So flavors was the 7th reason for initiating e-cigarettes. Only 11.8% of all adolescent vapers reported that the reason for initiating e-cigarettes was flavors. And let me clarify, the participants, the high school and middle school children, had the opportunity to choose more than one answer in this question. So if flavors played even a secondary role, they had the opportunity to choose, but still only 11.8% chose flavors as a reason for initiating cigarettes. And let's not forget that there are also studies showing that flavor restrictions may increase youth smoking, as this study showed in San Francisco at the University of, from the University of Yale. But let's say that we ban these flavors. What's going to happen? Well, we have this experience. I think I have about 4 minutes. Brazil, Turkey, India, Australia have banned or effectively banned these products. So what has happened in these countries? We have millions of users. Bans, in some cases like in India, resulted in a creation of a non-existent market. Before the ban, there was no one vaping there. After the ban, products have become available everywhere, of course, all of them black market, and of course, there was an explosion of e-cigarette use, but with 100% illicit products. And there has been an increased uptake of vaping by youth in these countries, of course, because illicit trade targets the most vulnerable groups, and youth is a vulnerable group. And I'll show you an example of not a low and middle income country, but of a very rich country, which is also an isolated country, Australia. The ban in Australia has resulted in multiple use over the last 7 years of e-cigarettes among youth, and this is the first group of bars. It is about 10% of youth 14 to 17 years old in Australia, a country where e-cigarettes are banned, reporting current e-cigarette use. And I will remind you that a few slides ago, I showed you that in the US today, where e-cigarettes are not banned, the current e-cigarette use among US adolescents is 5.9%. So banning does not prevent the uptake of vaping by youth. And flavor bans. I'll give you another example of a very rich country, Denmark. In 2022, they banned non-tobacco flavors. In 2024, they found that e-cigarette use was increased in 2 years by 70%, and 63% of them were using the supposedly banned flavors. And you cannot ban flavors because they come from the food industry, and you cannot effectively ban the products because they are not uniquely used by electronic cigarettes. And that is going to be my last slide. I think that in order to make a good regulation for the country, you need to be realistic. So examine the local context, the potential for illicit trade, which will introduce additional risks more than the uptake of legal products. Risk proportionality, I think you are very well familiar with this principle because you use it in all kinds of regulatory principles. You need, in my opinion, to clearly differentiate combustible products from all other products, and this should be reflected in the regulation with clear definitions and clear differences in applied restrictions. Marketing and communication, yes, I fully support restrictions, especially when targeting youth and non-smokers, but not a ban, because smokers, adult smokers, need to understand and learn that these products exist. Of course, you should ban the sales of youth. Of course, you should apply heavy fines to offenders, even apply age verification if possible, but you need to understand youth use will never be zero and will definitely not be zero if you ban the products. It will probably become even a higher risk for youth risk takers. I want to thank you very much. And I'm going to use 30 more seconds because I think that we as experts, when we address policymakers who are not experts in this particular field, they develop policies for everything, we need to be very careful not to spread, unintentionally spread misinformation. My first vape image that was shown previously, and I'm not accusing the previous speaker, probably she didn't unintentionally, is a meme. It does not exist. It has been fact-checked by Reuters and by other fact-checking organizations. So I urge every expert to be very careful, because if we don't search very intensively on what we present, we might be a source of misinformation, and we don't want to be, as the expert, the source of misinformation. Thank you very much.
Thank you, sir. Can you hear me, Mr. Kalamba? Thank you very much.
No, Chair.
Kalamba. Yeah?
You are not audible enough, Chair.
Yeah.
Okay. I don't know what to do. I have to change my gadget. Hello?
I can hear you, but not very
You are
loudly.
too soft, Chair.
Yeah. Okay, then let me remain soft then. At least you can hear me. Yes, I'm now using another gadget. That one I was using gave me a challenge. Can I recognize honorable members' hands? Those who would like to engage with the presentation. We can also assist us by just limited questions. Honorable Shabangu, number 1. Honorable Clark, number 2. Honorable Sine, number 3. Honorable Dr. Leroux, number 4. Honorable Dr. Letape, number 5. Honorable Motibatse, number 6. Honorable Zingula, number 7. Any other takers? Not so far. In that order, honorable members, Shabangu 1, 2, Clark, 3, Sine, 4, Leroux, 5, Letape, 6, Motibatse, and 7, Zingula. Thank you.
Thank you, Chairperson, and let me also appreciate the presentation. I hope I'm audible. I'm struggling a bit with my network. I'm not sure whether the presenter read the bill before coming here to present, because the bill does not ban vapes. The bill is aiming at regulating. I'm not sure whether he's aware of that, because if I listen to his presentation, it sounds like he is talking of banning. And also, want to know if where you are residing, if these products are not regulated. You sound very certain that there will be no risk that will be discovered about the vapes. No, not any more risk. And these are new products in the market. How sure are you that there will be no other risk that will be identified? Because we've been witnessing more and more effect of this vape, the detrimental effect of these vapes and the e-cigarettes. And for you to say there will be no more risk that will be identified, how sure are you about that? You also gave us a stat of smoking in South Africa. Are you aware that both tobacco and the e-cigarettes, the prevalence rate is increasing in South Africa? Would you suggest that this parallel increase is a harm reduction according to your understanding? Because there is a parallel increase of this smoking of tobacco and the vapes in South Africa. And you also, there is a clear evidence and studies that shows that people who use vapes end up using both products, the tobacco and the vapes. And it's the studies that were conducted and the evidence that is available, if maybe you know about it. What is your take on that? Do you call that harm reduction when a person is using both both products? Do you call that harm reduction? Thank you, Chair. And also another question that I want to know from the presenter. You mentioned that the reduction in the US, but how they tackled that crisis, you decided to omit the restrictions that were put in place. Yet you mentioned that in US, the flavors, the policies banning flavors, restriction to youth access and availability, they help you as to be where it is. But in your study and in your presentation, you omitted some important information. What is your point of mentioning US in your presentation? Thank you, Chair.
Thank you, Chair. We've had I'm sorry. We've had a number of presentations regarding harm reduction, and that of non-combustion is better health-wise than smoking. But are there no harmful chemicals produced by non-combustion? And if there are, what are they? Do they differ between different products? How is this currently regulated? And if it's not regulated, how would you suggest regulation and penalties for non-compliance? There are some studies that found long-term use of electronic cigarettes or vaping products can impair the function of body blood vessels, increasing the risk for cardiovascular disease. What is your opinion on this, and have you considered this for your presentation to us? Thank you.
Thank you, Chairperson. My first question, you have confirmed that cigarettes are the most harmful products. If it's that so, why are you not advocating for the complete ban of cigarettes as a way to protect people from the harms of these products? 2, what are the harmful effects of using vapes according to you? And my last one, Chair, are you aware that there are many African countries that have less smoking prevalence than Sweden. Uganda has 5%, Ethiopia 3.1%. How can you say Sweden is the only country that have been declared smoke-free? Thank you, Chair.
Thank you, Chair, and thank you very much to the Professor for presenting to us today. I'm just going to see if I can put my camera on, if you can see me okay. I just had some questions. You're the first person who's quoted research looking at the impact of nicotine, specifically in the context of snus and the long-term data they have on that. And I mean, one of the things I always keep on asking is how harmful is nicotine? You seem to indicate that there's certainly much less harm. Is there any indication from those studies, those long-term snus studies, that there is an increased risk of, well, what are the risks purely on nicotine? I know that with snus, it is a tobacco product. I know that that's usually on the lips, so that there is an increased risk because of the tobacco on the lips. But is there, and then have there been any studies done? I mean, again, from my perspective, if I look at all the different nicotine products, it seems like pure nicotine pouches are probably the least harmful on the spectrum of what we have. Are there any studies on nicotine pouches on their own? Is there any long-term data about that? I'm sure it's not been around for that long, but it would be interesting to get your perspective on that. Then I think that the big concern, the second question I just wanted to get a sense from you of is in terms of the current legislation that we have, what do you think is something that we should change, or the things that we should change to make the legislation more on a harm reduction perspective rather than a kind of treating everything at the same level? So you talked about harm differentiation, and so how would you bring that into the legislation? Thank you very much.
Thank you for the presentation. Hi, Konstantinos. Just two questions. One,
Hi.
In terms of product standards and nicotine concentrations, what would be your advice to this committee? What standards should we apply? Should we limit the concentration in vaping products? Should we limit the concentration of nicotine in nicotine pouches and the other alternatives? The second question, since you are an expert in this field, in terms of EVALI, were there any cases in EVALI that were related to nicotine vaping? Thank you.
No, thanks very much, Chair, and thanks, Prof, for the presentation. Let me start with the criticism by environmentalists, as they argue that single sticks in particular are environmental hazards. What is your take on that? And what is your perspective or your view on closed and open e-cigarettes? Because clearly one of the criticism would be open cigarettes would actually invite people to put in some issues that would not be legal, drugs, for example. What is your take on that, and what do you think should be done to intervene in that regard? Yeah, those are my two questions that I wanted to present to you. Thanks.
Thank you. I think perhaps mine would be to perhaps comment on the use of actual commentary based on actual research instead of assumptions which do not help the cause, because we're dealing with something that requires us to be scientific at all times when we're addressing the issue of public health. My first question is to understand how long is long enough to reach the definite conclusions about the harms of products. The previous speaker said we do not know enough about the long-term impact of propylene glycol on lungs. It may seem that in your presentation, you make a conclusion that we know enough to err on the side of permissive regulation for the new nicotine products. Then the second question, again, I think it is basically on the issue of how do we anchor evidence, how do we anchor science instead of maybe using our feelings or people using what they view on what they view personally on their side, which could be tantamount to spreading misinformation. Perhaps in that regard, yes, we know that the youth access or youth intake when it comes to accessing vapes and other related products is a problem. But how can we best tackle it now from a scientific point of view, not from a view of wanting to use emotions or to use things that have not been scientifically proven when it comes to research and analyzing the studies that have been done. Thank you.
My only question will be just based on what Honorable Sungula has asked, basing it that you will then support the first Honorable Shaba to say you did not bring a presentation to ban vapes because the bill is not saying that. Now, it looks like it is inevitable that this bill will have to accommodate vapes. And in what way, such that vapes probably are there but are not targeting the young people. And like I used to argue that if cigarettes have been menthol and mint, now people who then must be assisted maybe to switch on can still go on a mint and menthol flavors. What's the value of? Is this the value add to the sales increase? The issues of a lot of these flavors, because we still want to limit that to a great extent. That is all I needed to say. We may not really be able to do away with vape, but how then do we strengthen regulation? Because there are people in the industry who have made presentations to us say, please regulate us. We operate as we wish. It's different for cigarettes. We have done a bit of regulation. We are improving there on cigarettes, but on vapes, we have nothing to show. And that's why this bill is so urgent to come through and deal with that. Just improve on that input again on vapes. Thank you very much.
Is that all? Is anyone else have any question?
That is all, and by 22/7, you are wrapping up, right?
Okay. So, I fully understand that your plan is to regulate and not to ban vapes. I've read the proposal. I submitted a comment a few years back when you first released the proposal. Yes, my presentation included data on what will happen with the ban, just to show that over-regulating and over-restricting is going to create more problems than it will solve. And that was the purpose of that. I was not suggesting that your legislation is an effective ban or is proposing a ban. I want to clarify something, and I mentioned that repeatedly. I never said, and I don't believe that any of these products, whether it's e-cigarettes, heated tobacco products, or nicotine pouches, are risk-free. I don't believe that. We don't have any evidence that they are risk-free, and I don't think that they are risk-free. Perhaps I was not very clear when I discussed about the risks, or perhaps the perception that's coming out from my presentation discussing about very low risk maybe is confusing. So I will clarify by making a crude assessment of the risk of these products compared to tobacco cigarettes. Based on my experience and based on evidence that has been presented by others, for example, Public Health England, which has written many reports over the years about these products. So if we assume that smoking has a risk of 100, so it's the most harmful of all products, I would say, and as I repeat, that's a crude assessment of the risk. It's not entirely scientifically based. It's very difficult to provide a number, but this is very important also for you and for non-experts to understand what kind of risk reduction we're talking about, but also for society and for smokers to understand, because just discussing about lower risk means nothing. 90% of the risk of smoking is also lower risk, but it's almost meaningless. So if we assume that smoking has a risk of 100, I would say that heated tobacco products are at a level of risk of 15 out of 100. E-cigarettes are at a level of 2 to 5, and nicotine pouches and nicotine replacement therapies, pharmaceutical nicotine products, are below 1. So none of them are risk-free. So I did not mention anywhere that there is no risk, but in some cases, particularly nicotine pouches, and now I'm addressing also the question posed by Honorable Mr. Roux, particularly for nicotine pouches, the risk is extremely small, existent, but extremely small. Concerning the detrimental effects, I haven't seen till now any detrimental effects from vaping on the general population. There are isolated cases, and I'm sure we will find in the literature. And now I'm addressing also questions by Dr. Gossi and by also some others. EVALI is not caused by vaping, vaping nicotine, of course, and it cannot be caused by vaping, and there is a simple reason for that. The CDC and the FDA have themselves verified that the EVALI outbreak was due to vitamin E acetate. Vitamin E acetate is insoluble in nicotine products. You cannot dissolve vitamin E acetate in nicotine products. It's the same like trying to dissolve oil in a glass of water. They will separate. I have a video, if I knew I would bring the video with me, where I bought from a pharmacy store vitamin E acetate. I tried to mix it with an e-cigarette, with an e-liquid. It was impossible. After 10, 15, 20 minutes, there was clear separation of vitamin E acetate from the e-cigarette, because vitamin E acetate is lipid soluble and e-cigarettes are water soluble. And the second reason is that it cannot happen is because the reason that they used vitamin E acetate in the US was because it was cheaper than marijuana oils. So they wanted to adulterate marijuana oils and make them cheaper. But the user will not understand that this is a product which is contaminated with vitamin E acetate. The main ingredients of an e-cigarette liquid are cheaper than vitamin E acetate. So there is no reason, not even a financial reason, for someone to adulterate these products with vitamin E acetate. When you want to create illicit products which are cheaper, of course you use cheaper ingredients. It's not the case with vitamin E acetate. So there is no issue of EVALI. There is no issue of popcorn lung disease. I did a literature search very recently. There are 1,100 cases in the literature concerning bronchiolitis obliterans with dual use by Honorable Mrs. Sabangu. Yes, dual use is a very usual transition period that is happening also with medications. When we give someone a medication, we ask them for the first period to use both products. Of course, it's not ideal. Of course, it's much better for people to quit smoking. But I will answer by posing a question. if someone who has been smoking a pack of cigarettes, 20 cigarettes per day, goes down to 2 cigarettes per day and uses vaping, is that something we need to discourage? Should we tell this person that, no, you should stop vaping and go back to the original smoking consumption? I think no. So dual use can be meaningless. If someone is smoking every day and is vaping once a week, it's meaningless. It's like smoking only. But for some people who went from 20 to 5 or to 2 cigarettes per day, it's very meaningful, but it's not ideal. They still carry a lot of risk because unfortunately, the risk of smoking increases extensively during the first 5 cigarettes, and then it goes higher. There is a dose-response relationship, but not at the same level. The first 5 cigarettes create a lot of risk. As for the US restriction on flavors, the US market is filled with illicit vapes and unregulated vapes. All of them are flavored. And let me remind you that the biggest problem in the US came from Juul products, as you know. And Juul did not market at any time any kid-friendly versions like cotton candy or anything like that. They didn't even have any kid-appealing packaging and labeling design. Unfortunately, it's something that happened in the US from a company which was not selling neither by flavor nor by name, packaging, labeling, and appearance anything kid-friendly, but unfortunately they used social media and it became a trend. And I agree with you that this is something that you need to avoid, and proper regulation with heavy fines and restrictions, bans, of course, on the sales of these products to youth is a necessity. Yeah, we supported that in Europe since 2014. Honorable Senate discussed about banning cigarettes. Yes, I think that that would be ideal in an idealistic world. However, in a realistic world, banning of cigarettes would create an explosion of a black market. And second of all, it's inhumane for cigarette users who are addicted to a product to suddenly ban access to these people for such products, because they will be in such a distress, they will be so terrified. It's inhumane for them. Now you're going to say, and I will agree with you, how humane it is to provide cigarettes to smokers. Yeah, you're right. You may be right, but it's something that cannot happen. What can happen in the not near but more extended future is by exploring this and increasing accessibility and variability of alternative products, eventually reach to a point where no one would be using cigarettes and at some point they would be eliminated from the market. But to create a sudden ban on cigarettes, I think South Africa also has the experience from the COVID pandemic. And I remember a report from the University of Johannesburg, which said that the ban on the sales of cigarettes during the pandemic created an explosive black market of illicit trade for tobacco cigarettes. So unfortunately, it cannot be done. Honorable Ruud is asked about the long-term effects of nicotine. Yes, snus, as you correctly mentioned, is a tobacco product. It contains toxins, very low levels, but it does contain toxins. Still, for myocardial infarction, heart attacks, for stroke risk, they found zero risk. And these were studies performed by by Karolinska University in Stockholm. They were not performed by the industry, yeah? And I can quote the conclusion in the abstract of one of the studies, which examined heart attacks and found no elevated risk compared to not smoking, not using anything. They said, so substances other than nicotine are implicated in the pathophysiology of smoking-related heart disease. That was the quote from the authors, the researchers from Karolinska University. Now, Is there any residual risk? Yes. They expose users to some level of toxins, much lower than smoking, but existent. And that's why I expect that there will be some residual risk. But these are not simple consumer products. These are products that are primarily addressed to smokers. And I think the regulation should include some provisions to provide guidance, evidence-based advice, and communication messages to smokers, while at the same time heavily restricted and banning marketing attempts towards non-smokers and particularly youth. And that's why you need to have a separation, because rightfully so, all communication activities are banned for tobacco cigarettes, and that should remain. That should be different for harm reduction products, but specifically addressing adult smokers, not all the other groups. I agree also with Honorable Mr. Ru that pouches appear to be the least harmful of all products. There are no long-term studies of that, but we can bridge the evidence from snus, and considering that pouches do not contain any tobacco, we expect it to be equally good or even better than pouches, than snus, sorry. So again, not risk-free, but very close to being risk-free. How long is long enough? To be sure, someone asked, I think it was Honorable Mr. Zungula, how long is long enough? Well, in science, you're never sure about anything. So we'll never be sure about anything. I will just remind you some cases that happen with medications. AC inhibitors, very common antihypertensives, which were developed and became available in the 80s. 30 years later, we found that they increased the risk of lung cancer by 30%. A very common antihypertensive medication which was available for 40 years. Why? Because it is impossible to examine the long-term effects of any product, including medications, before marketing them. So even in the case of medications, you market them after a lot of course, research, but not long-term evidence. Someone who is taking an antihypertensive medication will probably take it for 30 years every day, for 40 years. It is impossible to generate 30 years of use data before accepting and allowing marketing of these products. This is, we address that by what we call post-marketing surveillance. The same should happen with the cigarettes, and all my recommendations are based on what we know until now. And let me tell you that even in medicine, but also in policy, we make decisions based on current knowledge. We cannot be prophets. We cannot, of course, predict what's going to happen in the future, but we have more than reasonable evidence about the lower risk potential of these products. And because, as I told you before, the lower risk potential is very, very large compared to smoking. It's not zero, but it's a big difference compared to smoking. That's why I support a clear differentiation within the regulation and with the restrictions, a clear differentiation between combustible products and non-combustible tobacco or non-tobacco products, nicotine products. And how to use science? Use the totality of evidence. This is the only way, because, of course, when you have thousands of studies, there are going to be some studies which may show some bad things, but that does not mean that that's the conclusion we have about the product or the product category. I will give you an example. Very recently, a very bad study for e-cigarettes was published on metals. The problem in the study, yes, and I'm finishing. I don't have anything else besides the flavors. And the study found that two products emitted very, very high, tremendously high levels of metals. These products were using banned, prohibited materials, for example, lead-containing soldering, that were eventually leached into the liquid. And of course, you need to have regulation with strict product standards. And I will give you the solution. It's very simple. The European Union is using a standard. The European Union has a database where all products need to be registered before marketing, before being marketed, with all their ingredients listed. The ingredients list remains confidential within the database because it's a commercial secret, but every manufacturer has to present a file to the authorities with data on the products, with a whole list of ingredients. They are not allowed to use any toxic, carcinogenic, or genotoxic compound as a flavoring, as an ingredient. And after they submit the file, they are allowed to market the product. This is something similar which can be implemented in South Africa or everywhere else. As for the flavors, as I said, and that's the experience that we have, banning flavors, non-tobacco flavors, I mean, will not reduce uptake and access to youth, because you cannot ban flavors. They are not unique for e-cigarettes. And the experience, even in well-organized and rich countries, has showed us that. I showed you the example of Denmark, but also Australia. All of them are using flavored products. I think I have addressed everything, and I have clarified that I don't feel or think or believe that these products are absolutely harmless. And that's why I'm talking about smokers, not about the general population, non-smokers or youth.
Thank you very much. Don't go over
Thank
your
you.
time, Prof. You have done well. You managed to answer all within your time. Honorable members, this issue of banning or not banning, I wanted just to give you, when we were running short of cash as prisoners in Robben Island, we would restrict buying any other thing except cigarettes, because we just thought this was not the right time and the right place to ask people to stop smoking. The stress was too much. So yes, it can never happen anywhere in the society. People have already chosen this route, so we can always try and reduce the harm that they do. Prof, thank you very much. Your input has assisted us. It will also be enriching our discussions as a committee when you tie up everything. We want to thank you very much for your contribution.
I thank you. It has been an honor to present here, and thank you very much for giving me this opportunity.
Okay. And now you can stay behind if you wish. I'm now calling upon another professor, Professor Khayat, if the pronunciations are correct. Professor Khayat, again, as a professor, I'm sure you are used to giving a 1-hour lecture. You are not able to do that here. Your presentation, which by the way we have seen and read, is for you to take us through it quickly within the next 30 minutes, so that at 7:10 we can be able to then start interacting with you as honorable members by questions and clarity-seeking comments. So your 30 minutes starts now. You are welcome not to use your whole 30 minutes if you wish. Thank you very much.
Yeah, Mr. Chairman, honorable members of the Parliament, it's a real honor for me, and I want to thank you for this invitation. Can I have my first slide, please? Slide.
Who is doing slides for you, Prof?
It's supposed to be you to pass the slides.
Okay, Ms. Machalamba, are you assisting there?
Can you?
Ms. Machalamba, who's assisting you the slides?
I thought that, I mean, when I asked, it was said that you were supposed to pass the slides, because...
Yeah, Ms. Machalamba, If you agree to do that for us.
No,
please.
Chair, I did not agree to do that, but I'm looking for his presentation.
Thank you very much, Ms. Thank you. Thank you. I can start?
Yes, you can start.
Okay, so thank you for this invitation, as I said. And let me introduce myself. I am David Khayat, Professor of Medicine of Oncology and former head of the Medical Oncology Department at the Pitié-Salpêtrière Hospital. And I was the former president of the National Cancer Institute of France and former director of the American Society of Clinical Oncology, the ASCO. Well, let me first start by telling you a little about sorry.
Just put the slides in a normal way. Don't put 2 slides at a time, one at a time.
One at a time, yes. I'm sorry for this inconvenience.
Just leave it at that rather than to, if you can't put, there is hourglass thing at the bottom there, just click on it to show that it is a slideshow. Yes, thank you very much.
Okay, so I just introduced myself and let me tell you who I am and what I've done and why I am here today to discuss why those matters and why science and compassion are so important for tobacco control. Next slide, please. For decades, I have dedicated my life to fighting cancer, not just in the operating rooms and clinics, but also through public health policy, national cancer plan, and education. I have written books, worked on documentaries and films, and even trained as a chef because I believe health is not just about medicine. It's about how we live, how we understand risk, and how we care for one another. Next slide, please. I want to speak frankly for just a moment, not just as a scientist or as an oncologist, but as someone who was in the same fight as you for decades. I led the French National Cancer Control Plan and helped shape tobacco control policy for 5 years during the presidency of Jacques Chirac, of whom I was the advisor. We increased the tobacco tax very significantly. We banned indoor use. And now, looking back, I must admit that what we did in France on tobacco control was, in many ways, a failure. Smoking rates remain very high. The illicit market is thriving. And despite our best intentions, we focused more on prohibition than on pragmatism. We underestimate the role that harm reduction could play, and in doing so, we left many people behind. If I had looked more closely at what Sweden was doing, offering smokers safer, regulated alternatives like snus, I might have seen another path. Sweden embraced harm reduction, and today they have the lowest smoking rates and among the lowest smoking-related disease rates in Europe. Next slide. Let me just disclose my conflict of interest. I am the advisor of Philip Morris, but only on harm reduction on smoke-free products. Not obviously, as an oncologist, I will never work on a company providing advice on combustible cigarette. And I am also the advisor of many other companies, food industry and everything. Next slide, please. As an oncologist, I have spent my career studying why people get sick and how we can prevent it. And one of the first lessons you learn in cancer is that risk is not the same for everyone, and it's never all or nothing. But when I speak about cancer, both from science and experience, the one thing I know with absolute certainty is this: dose matters. Most of the cancers in the world are due to the exposure to a carcinogen. And it is perfectly known that the greater the amount of carcinogen you are exposed to, the higher the risk of cancer. Risk is not, therefore, a light switch. It is not on or off, and it is never all or nothing. Risk increases with exposure, as I said. How much you are exposed to, how often you are exposed, and for how long the exposure lasts. There are other factors in risk, things we can always control, such as genes, our environment, the world we live in. But cancer is always a dose due to the dose-response relationship between the exposure to a carcinogen and the risk of developing cancer. Next slide. Let me ask you something. How many of you have seen someone you love suffer from a smoking-related disease? Maybe a family member, maybe a friend. They are not distant statistics. They are real people, people whose lives might have been longer, healthier if we had acted sooner or acted smarter. This is why I'm here today, not just to talk about tobacco as a product, but also to talk about people, the people we can still save if they're willing to look at the problem differently. If we combine science and compassion, every reduction in harm, every extra year of life becomes a victory worth fighting for. Tobacco control must focus on saving people's lives, not just banning products. Next slide. Think of alcohol. We don't treat someone who has one drink the same way as someone who drinks a bottle of whiskey every day. The International Agency for Research on Cancer, IARC, said it clearly in their European Code Against Cancer. Any reduction in consumption reduces the risk. Yet, in tobacco control, especially here in South Africa, we often hear this phrase, harm is harm. This is not science. We cannot just decide because we are talking about tobacco or nicotine use, that all use and all products are equally dangerous, that this ignores what we know about science. We know that how a product is used and how much a person is exposed matters. Next slide. You can see that also in these slides, where you can see on the left part that the more red meat or processed meat you eat, the higher your risk of developing colorectal cancer. Dose-response relationship. Next slide. You can see also the effect of the duration. You can see that whether you smoke less than 20 cigarettes a day or more than 40 cigarettes a day, the number of years you have been smoking is going to increase your risk to develop lung cancer. And it must apply to tobacco as well, this notion of dose response. This is one of the key points in my presentation. You have to understand that all the risk-reduced products that can deliver nicotine without the smoke due to the combustion of tobacco leaves, deliver no carcinogen, a usually lower level of usual carcinogen present in the smoke of combustible cigarette, and usually in the range of 82 to 90%. And therefore, a lower risk for the consumer. And this has been demonstrated by a lot of regulatory agencies such as the US FDA, the RVIM, the Public Health England, and the BFR in Germany. Next slide. This is a very important point I want to raise. We cannot let our fears on nicotine be misplaced. We need to remove the emotions from the scientific debate and go back to what we know. Smoking causes cancer, but nicotine, while addictive, does not cause cancer. It is the burning of tobacco that releases a deadly mix of carcinogen, acrolein, benzene, formaldehyde, heavy metals. And this is why countries like the UK say that vaping is at least 95% less harmful than smoking. It is because it removes the combustion. Next slide, please. And so what does that mean for South Africa. It means that the 7 million South Africans who smoke today are not all doomed to die from smoking-related illnesses. If we give them alternative, right now, around 2,000 South Africans die every year from smoking. That is the equivalent of a plane full of passengers crashing every week. Would we accept that if it were planes? Next slide. And Sweden, as many other speakers said, next slide, Sweden gives us a powerful example by offering smokers a much less harmful alternative, the snus. They have reduced their daily smoking rates to just below 5%, the lowest in Europe. And their lung cancer rates are among the lowest in the world. What can South Africa learn from that? That harm reduction can save lives. Next slide. If we fail to recognize dose and relative risk, we leave people trapped with the most dangerous product, the combustible cigarette. We can't allow that to happen here. We need to remember that tobacco control isn't about fighting a product. It's about helping people. Next slide. For too long, smokers have been treated like statistics, or worse, like problem to be solved. I'm treating patients with lung cancer for almost 50 years. So I know exactly what is the face of a patient learning that he has lung cancer, that he's going to receive chemo, radiation, surgery, and ultimately will most probably finish by dying. We tell them what people are telling them, what doctors are telling them. It is quit or die. What about the millions we cannot quit? Or the millions who try, fail, and feel hopeless? I have patients tell me, I feel like I'm being punished because I can't stop smoking. And that breaks my heart because that is not what public health is about. Next slide. Public health should never be about shame. It should be about support. In 2000, on the 4th of February, we signed the Charter of Paris Against Cancer at the Élysée Palace with Jacques Chirac, President of France, and Koichiro Matsuura, Director General of the UNESCO. This is why the 4th of February became the World Cancer Day. This reminds us that dignity and empowerment are the foundation of any successful health policy, and South Africa already knows this. Next slide. South Africa knows this because when you were facing the HIV/AIDS epidemic, you didn't succeed by pointing fingers at people with the disease or demand perfection from them. You succeeded because you embraced harm reduction, condoms, ART, education. You met people where they were, and you saved millions of lives. What would you now treat smoking differently? If you can give smokers a path to something safer, while continue to help them quit, I have to ask, why wouldn't you? Countries around the world that are embracing this logic, the UK, Japan, New Zealand, the US, are seeing their smoking rate drop dramatically. In South Africa, this has not happened. There has been no clear decline in smoking in recent years, in fact, and may have even risen slightly. If we don't change our approach, it won't. Next slide. Let's talk about regulation. We need to add compassion to our science because policies that don't consider the human experience are policies that usually fail. Now, let's talk about regulation because this is where South Africa has a unique chance to lead. Next slide. Let's see the lessons from the US. The US shows us both what to do and what not to do, which can be example to learn from. When e-cigarettes first came in the US, there were no rules, no product standards, no marketing limits, no age protection, and youth vaping exploded. That was a regulatory failure. But then they stepping in, regulated, and quickly we saw the youth vaping number drop. It has been shown by another speaker and reported by the Center of Disease Control, CDC, in the US. Youth tobacco product use is at the 25-year low with cigarette smoking all but eliminated, and only 1.4%, the lowest level ever recorded by the National Youth Tobacco Survey. But on the other hand, they may have gone too far in another direction. The FDA has designated a very cumbersome, expensive, and timely approval process that is so strict that less than 10% of products on the market are actually authorized. That means that around 90% of the US market is now illicit or unauthorized product, mostly disposable vapes coming in illegally from overseas. In other words, the regulators have lost control over the products people are actually using. Next slide. These are lessons that South Africa and your committee can learn from. If you regulate too lightly, especially on flavors, sales, and marketing, you risk low quality products and use uptake. If you regulate too heavily or without product standards, you can lose control and create a black market. You need to find a balanced and a science-driven framework that protects youth while ensuring that adults have access to safer options that they are willing to use. Next slide. We can have lessons from Japan also. And all we have to do is look to Japan to see that this can actually work. These heated tobacco products have replaced over 52% of cigarette sales without a rise in youth use. We can sit here and ask if this matters from South Africa, but it does because it proves that adults can and will switch away from cigarettes if safer alternatives are available, regulated, and trusted. Next slide. But it's more than just having the products available there. Also needs to be clear communication so that people understand what these products are and what they are not. They need to know that quitting is best, by far the best option, that these products are addictive, but also need to know that these products are better than smoking, and that is, if they cannot quit altogether, that these are better than continuing to smoke. They need accurate risk-based communication, like we have for all public health approaches. Think back to the EVALI outbreak in the US in 2019. Everywhere you were hearing vaping kills. Somebody said that even this afternoon. But the truth was that EVALI was caused by illicit THC product laced with vitamin E acetate, not regulated nicotine vapes. But the communication failed. The consumers, vapors got scared, and some returned to cigarettes, which are far deadlier. We cannot allow that kinds of confusion here. Next slide. South Africa draft tobacco and arms control bill is an opportunity to get this right, to avoid the mistakes others made. You need set product safety standards, ban use targeted flavors and marketing, enforce age verification and penalties, and still give adult smoker access to safer alternatives. This is how we can save lives without losing control of the market to illicit product. Next slide, the conclusion. So what does all of this mean? The science tells us that harm reduction works. The human stories tells us why it matters. And the lessons from other countries show us what to do and what not to do. But here's the heart of the matter. South Africa has an opportunity to lead. We can build a policy that does not choose between prevention and harm reduction, but combines both to save the most possible lives. The best thing we can do is prevent people from starting. But for the millions who already smoke or we are going to start, you have a responsibility to offer them better choices, safer products, accurate information, and the chance to live longer, healthier lives. This isn't about being soft on tobacco. It's about being smart, compassionate, and pragmatic. It's about protecting young people while helping adults. It's about reducing harm wherever we can, step by step, life by life. Last slide. Next slide. South Africa can set an example for the world. You can show what leadership looks like when science and humanity come together. I believe you in this room can take decisions that will save tens of thousands of lives in the years ahead. The science is there. The tools are there. Now, There is the only question. Do you have the strength to use them? I hope. Not. I believe you will do. Thank you very much.
Okay, Prof. Thank you very much. Now you must have a pen and paper because members are going to engage with you. You reply all those questions at one time. Oncologists, thank you for your input. Honorable members, let me recognize those who've got one or two questions. Starting with Honorable Dr. Leroux. Dr. Leroux. Honorable Sinne. Number 3, Honorable Clark. Number 4, Honorable Mutubatsi. Those are the 4 I've seen now. Honorable Mare. Okay. Honorable Echalekape. Let me keep on checking. The first one is Honorable Dr. Leroux, followed by Honorable Sinne. Honorable Sinne will be followed by Honorable Clark. Honorable Clark will be followed by Honorable Mutubati. Honorable Mutubati will be followed by Honorable Mare. And the last hand is Honorable Lekape. In that order, Honorable members start.
Thank you very much, Chair, and thank you very much to the presenter. Can you hear me okay?
Yes.
Yes.
Thank you.
Thank you. And thank you also for your lifelong fight against cancer and helping patients. I think it's a very inspiring story. I just was interested in your, one of the things that we haven't heard much about is the heated tobacco products. So I see that you mentioned that in your presentation, also spoke about the incidence of that in Japan. So it seems like a heated tobacco products. Not vapes, but actually using cigarettes, but heating them, but not burning them is what they use in that part of the world. I was just interested in hearing why they do that and why vaping hasn't been such a big thing in that part of the world. If I've understood it correctly, you look like you, but I just wanted to get an understanding about that. I also just wanted to one of the things you mentioned in terms of the regulations that you propose is around the regulation of flavors with nicotine, with vaping, and I just wanted to get a sense of what you. I mean, there's been quite a lot of debate about that on the committee, and so some people talk about mention that it's very important. There's always concern about the drawing in the youth market with interesting sounding flavors. On the other hand, there's also this feeling that without flavors we cannot get people off from the more harmful products to the less harmful products. And I just like to get a sense of what you when you say we should regulate flavors, what do you mean with that? Thank you very much.
Thank you.
Thank you, Chairperson. On slide 19, you referred to HIV and AIDS strategies. How is the current targeting of children to start using these products part of the harm reduction? Or were the HIV strategies targeted to encourage children to expose them to HIV by using influencers or flavors? How would you then suggest that young people should be protected by this bill? And the second one, Chair, is almost similar to the one of Dr. Leroux. You claim that cigarette sales have declined in Japan, but you failed to acknowledge that in the same Japan, heated tobacco products use among the youth has been increasing. Also, you failed to disclose that Japan has banned all e-cigarettes containing nicotine. Do you also recommend that we ban these products in South Africa, because you can't pick and choose policies just because it suits your narrative? Thank you, Chair.
Thank you, Chair. Is it you or me? I can't remember. I'll go after you, Patrick.
No, you can go ahead so that you can rest.
Oh, tell you if you know how I feel. I could just get into bed and go to sleep. Thank you. Thank you very much for your presentation. Do you have an opinion on adjusting legislation in some way for non-disposable and disposable vapes, for instance? And if so, in what way? In what way would you amend the bill to ensure a balanced approach to regulating vaping and other non-combustible tobacco products? And when you say youth-targeted flavors that you want to ban, do you mean all flavors or specific flavors? And what flavors do you wish to ban? And what would you consider to be reasonable penalties for violations? Thank you.
No, thanks very much for the Prof for the presentation, insightful presentation. Prof, we've heard a lot on the importance of incorporating science into this. We need to understand the impact of not recognizing differentiation in this bill in terms of the public health system. Which country do you think is making good progress around differentiation? And what if this differentiation is having a positive impact on public health? Secondly, we know that the nicotine replacement therapies contain nicotine as well. Is this nicotine the same nicotine that is in nicotine pouches? If it is, then it should not be causing cancer, or is nicotine toxic as outlined in the preamble of the bill that we are currently working on? Now, how can we implement a harm reduction approach for South Africa if you can advise around that particular issue? Thanks very much, Chair.
Thank you, Chairperson. I also want to say thank you for the presentation. I just want to understand, the presenter said if you don't regulate the use of these vapes and things, if you don't use it, regulate it properly, you are going to have a problem. But even if you over-regulate, you also can have a problem. So I would understand what this portfolio needs to do to make sure they have the proper regulations, so that each and everyone is happy with the outcome of this bill. I also would like to know that everyone is talking about Switzerland and the vaping that they are using that side, and the smoking has gone down. I don't understand, because for me, vaping is also smoking. So I am just a little bit confused. I think I'm more confused tonight than any time before this, because you talk about the cancer, and then you say the reduction of smoke, and then you talk about the harm of the smoke, and then you say there's alternative. So what is the alternative that we can use, except the ones that you have just mentioned about Japan and then about Switzerland? Thank you.
Thank you, Chair. I just have my question is, what would your suggestion be? Should it be that we incorporate one piece of legislation, or we create a separate piece of legislation? This is how we deal with tobacco traditionally, with the augmentations that have come. This is how we deal with the alternatives to combustible cigarettes. Or should it be in the same bill? Because there'll be the issues of how do you give out credible information? How do you separate the marketing policies? Or do they now just become one? If these things are less harmful, should they all be banned from public spaces? If I'm now using a risk-reduced product, would I need a designated place for non-combustible nicotine use? Or should I now be sitting in the same room with the smokers if there's an area that's designated for nicotine consumers? Those basically are my questions to the professor. And thank you for the presentation.
Thank you. Can I start to answer? Okay, so first, thank you. All these questions are very interesting. First, to Dr. Leroux, Indeed, I didn't talk specifically on one of the products.
You are now muted, Prof. You are now muted.
Okay, so I was saying that I thank all of you for this very interesting question, very. First question was by Dr. Leroux about the fact that I didn't talk specifically about heat not burn, I mean the heated tobacco, because I didn't want to talk about one specific product or even give the list of products and give the advantages of each one of them. I wanted just to discuss about the, about the reduction of the risk.
By 25 to 8, you must have completed your presentation, your reply.
Sorry, I cannot hear you well, sorry.
25 to 8, you wrap up.
Okay, 14 minutes. So I was saying that I didn't want to address each one of the products, but rather to discuss about the concept of harm reduction based on the scientific information that those matters. That is the point of all what I've been doing in my life as an oncologist, treating thousands of patients for 50 years. So why Japan, you said, the question, and Japan, there was a huge impact on heat not burn because there was the first country in 2016 where the product was launched. And at that time, there was no other alternatives for reduction of the risk. And today we can really see a huge drop in the sales of combustible cigarette in this country. And, you know, every combustible cigarette which has not been smoked is a chance for a patient for having a lower risk to die from tobacco-related disease. About the flavors, I think that there is an open discussion about that, and all the speakers before me addressed that issue, as I did. The question is that probably we need to limit the authorized flavors to those which will not attract the youngest people and the more vulnerable people in our societies. Regarding the question by Lele Sene about HIV, well, you know, asking a young man to use a condom is a risk reduction process because you continue to have sex, AIDS is still there, but by using this device, you reduce the risk to get it. The second part of the question was about the use uptake of HTP. Actually, in Japan, there's been a study showing that this uptake is very, very low, is less than 5%. And one of the reasons I've been listening all the afternoon to the presentation is that we know that teenagers are happy to use something that is forbidden. So when heat not burn products are allowed in Japan, it is not forbidden. So the attraction to that is much lower than if the product would have been one, banned, and second, therefore sold by on an illicit trade. The next question was about disposable. I think we should ban or very much control, I mean, a huge, severe regulation of disposable, because these are cheap, low quality products that are very attractive to youngest people. And I don't think we can, it's so cheap, so easy to buy that I think we should really think about a huge regulation of that. What I propose is a harm differentiation bill regulation. And what's about the penalties? The penalties should be significant so that people that are not following the rules will think twice before doing that again, because everything, I mean, I am father and grandfather, and the thing I don't want is my kids and my grandkids to start smoking or to become addictive to anything they were not before. The question made by the Honorable Motubatse, I think that there is countries where there has been a differentiation. For instance, the US FDA and the General Surgeon in the United States, I've asked not to put health messages that smoking kills on the sticks for heat not burn, because the risk is so low with this type of products. It's about, as Dr. Farsalinos said, it's in the range of 10-12%, that you don't need to put that. And the question then was about the toxicity of nicotine. You know, I've been prescribing nicotine replacement therapies for the last 30 years to hundreds and hundreds of my patients. Did I prescribe a toxic, a carcinogen? No. These, even in my country, are totally free, over the counter, because we know that nicotine does not give cancer, and actually it does not give any kind of significant health disorder. So for Honorable Ms. Marais, I think we have, it was not Swiss, it was Sweden. And these people are not smokers because there are no smoke. So smoker comes from the smoke. And these people are using electronic cigarettes, heat not burn, snus, punches, and all the others, and they are not having smoke entering into their lungs or anywhere in their body. So they are not smokers. They are people using a device to get nicotine because they need nicotine. They cannot stop. You know, most of my patients and studies have shown that this is the case of 64% of this kind of patient. When you get a patient with lung cancer, a smoker, and you explain him that he should stop smoking, 64% of them are going to continue to smoke until the end. And they know that this is very bad for their health, that they're going to decrease their chance to survive, but they continue because it's an addiction. And it's not, you know, quit and ask them to quit and they will quit. So this is why the tobacologist that sentence that, philosophy that they use, which is quit, or if you cannot quit, I don't care, you can die. No, I am a doctor, I am seeing patient, I am empathy with my patient, and if they cannot quit, although they would like to quit because they know their lives are in danger, I want to offer them an alternative and not let them being trapped in a situation where the only way to get the peak of nicotine, which does not happen with the nicotine replacement therapy, is going to be combustible cigarette. And the last is the bill. The last question was about the bill. You know, I was in charge of the policy against cancer, so therefore the policy against tobacco smoking when I was the advisor of Jacques Chirac for 2002 to 2006. And we did a lot of things to that, the banning in public health, the increase of the cost of pack of cigarettes, but all these measures have relatively failed. So we need to do a kind of arm differentiation policy. So to first of all, do everything possible to avoid people to start smoking. If you are a smoker, to help you doing the maximum you can in the bill to help them to quit smoking, access to nicotine replacement therapy or whatever. But if they cannot, let them get the nicotine they need with a less harmful way, less harmful device, not combustible cigarette. And that is just to conclude. And again, I'm not a scientist, I'm not an epidemiologist, I'm not a politician. I'm just the average oncologist working, for 50 years. And I think that this is what we need to give to our patients. That is what they are expecting from us. Thank you very much.
Prof, I'll have tea with you because it came in too soon for me to ask questions, but don't worry.
Sure.
You covered me well. I have been covered by my colleagues. Thanks for that. It improves on our basket of information that we need as we process this bill going forward. You may stay behind as we take the last presentation, but thank you for your contribution. It will be used as part of our work going forward. Appreciate it. Thank you.
Thank you. Was it a question? The sound was very bad.
Sorry. No.
No, okay, thank you. Thank you. Sorry, excuse me.
I'll have a question for you when you have tea because you blocked me. I'm joking. We didn't really noticed I was about to ask a question. That's fine.
Okay.
I'm covered by my colleagues. Thank you very much.
Thank
Ms.
you.
Majala, on a marathon of work, you now want to give us the last presentation of Du Plessis, Miss or Mr. Du Plessis, who also is coming in to present, to introduce himself. Starting now, thanks Professor Khayat for saving our time. 7:25, we start. At 10 to 8, he will be done with a 30 minutes presentation or before. Over to you, Du Plessis.
Thank you, Mr. Chair. Can I please ask permission to share my screen?
Yes. Can you also allow sharing of the
Yes,
screen?
I have permission. I have the permission now.
Thank you.
Thank you. Good evening, Mr. Chair, honorable members. Thank you for the opportunity to have half an hour to raise some specific points. I know it's late in the evening. I will be speaking as quickly as possible. Who am I? I am a technical and regulatory expert on regulation, on the drafting of laws and regulations. And I'm also a technical expert on public international law, the way these international conventions are negotiated. I've been doing this for 30 years, and I've advised clients in about 70 countries. For full disclosure, I have also advised amongst many companies and industries, the tobacco industry, and also from time to time, the electronic nicotine delivery industry. The presentation I make tonight is made in my own name, my own views as an expert, because I have followed this bill from the beginning. I have participated in the NETLAC process as part of advising the BUSA and business segment in the NETLAC process. And my purpose tonight is basically to look at what are the main drafting issues that I see in the bill, and to maybe try and come up with how can they be resolved? What can Parliament maybe do? It's not for me to instruct Parliament what to do. Parliament has major powers. It is for me to suggest what is probably necessary going forward. Now, when I look at the NETLAC process, I want to lift out 5 points which clearly came up time after time as the NETLAC process evolved. And we have to understand here that this bill is quite unique in that it was put into Parliament and then it went into the NETLAC process. But I will cover that later. But basically, what came up time after time in NETLAC was that there was no relevant reference to or cognizance of our very unique national circumstances and conditions in the bill. In national and public international lawmaking, national circumstances and conditions are paramount. And yet this draft appeared to be completely silent about them. The second noteworthy point about the draft bill was that there was a precautionary approach which was fixed and which left no scope for any developments in the evidence bases that could have occurred over the last 10 years or for product differentiation based on risk. The debate was over. The risk debate, the evidence debate was over. And I'll explain a little bit later that it's not only the wording of the bill, it was also the views expressed in the NETLAC process. Then another interesting part about the bill was that there was a monitoring and oversight mechanism, which appeared completely foreign, either from the tobacco control national, international law perspective and from our national South African law perspective. Then there was a section in the draft which made public international law national law without mentioning it or following the prescribed procedure in the Constitution. The second last point was that there were confusing overlapping provisions on regulatory powers, especially as they relate to standards. And then the last very pressing point was that powers were asked from Parliament, which very, very much resembles primary legislative powers, with neither a framework directing how these powers would be exercised or requiring any subsequent oversight by Parliament. So I'm not going to do all these points in detail now. I don't have time. So on national circumstances and conditions, all that I can say is I've heard many speakers in many fora saying that this bill was completely ignoring the fact that the minority of tobacco products in this country are actually manufactured and sold legally, that we have a unique circumstance of tobacco use apparently going up while it's going down in most other countries, and so on and so on. I'm not going to spend a lot of time on that. I think the committee has also heard that we are unique in the world now, probably one of 3 or 4 countries with tobacco use going up, tobacco being amongst the most available and cheapest products available, and the tobacco control mechanism, not only or specifically the tobacco control mechanism of pricing, having completely collapsed in view of products being available cheaply everywhere in the country at a massive scale. I'm not going to go too much into this one. The precautionary principle frozen in time, the preamble of the bill refers to the precautionary principle, but it is a very interesting approach because what is in the preamble was added onto by the NETLAC process. And in the NETLAC process, various advisors to the government basically conveyed a view that the debate was over. The evidence had been considered at a certain point in time, and the debate was over. This is not how the precautionary principle works, unfortunately. The precautionary principle is an ongoing judgment made as the evidence base developed, and it was really problematic because in this case now the way the precautionary principle was exercised meant that there was no scope for further developments on the evidence to be considered, and there was also no further scope to consider product differentiation based on risk. Everything was fixed. Then, like I said, product differentiation was rejected, again, to some extent by the wording of the bill, but this was confirmed in the NETLAC process by the people advising the department. We have heard it, harm is harm, any risk is unacceptable, no difference between products, equivalence, maximum equivalence, you would have heard all these terms before. Then there was the monitoring committee in the bill. Quite an interesting phenomenon in the bill, because there are actually 2 best practices that could be considered. The one best practice that can be considered, recommended best practice, is actually in the Framework Convention of Tobacco Control. And the Framework Convention on Tobacco Control actually has an article which recommends, and which actually is a binding article 5.2a, which says that government should establish not a monitoring committee with a unique nature, but a national coordinating mechanism. So the monitoring committee we see here does not follow FCTC principles or propositions. does not follow through on what is in the preamble as to what the purpose of the bill is. This is why there was a feeling that a national monitoring commission of government departments mainly was what the FCTC proposes and is simply not in the bill. Then also in our national administrative sphere, our government has certain monitoring and compliance initiatives. And again, this was not followed. So the committee is quite a novel proposal, almost some people would say landing from outside of the country. It appears to have legislative powers, executive powers, and administrative powers, and it is given the right to enforce a duty on other parts of governments to assist the committee on excluding stakeholders from exercising recognized rights such as engagement and participation. So this monitoring committee is really problematic in my view, just because it is out of line with both international and national best practice, and there are clear risks to democracy and to stakeholders and to policy making in the way this committee and its powers are described in the bill. Then there's an interesting thing also under the committee. It's the following words: the minister, officials of the department, and other state organs must assist the monitoring committee to protect the development and implementation of policies relevant to the control of tobacco products and electronic nicotine delivery systems from the commercial and vested interests of the tobacco and electronic nicotine delivery systems. The underlined bit comes straight from the text of the Framework Convention of Tobacco Control. Yet nobody told Parliament or the legislative process that in order to make non-executing international law obligations part of national law, there's a procedure that has to be followed, Section 231(4) of the Constitution. This specific wording in the bill also extends the Framework Convention of Tobacco Control's wording to additional stakeholders. This wording had an interesting history in NETLAC. It started out with a very strong call that this was binding international law, which had been made part of South African law. And when the contrary was demonstrated, it ended up being a claim that this wording was just a coincidence, that it was identical to the words of the International Convention. So this is a problem in the sense that it's an irregular incorporation of international law and an undermining of democratic rights of stakeholders. The next point that was very interesting in the draft bill was a confusion between regulations and standards. Section 8, titled Standards on the Manufacturing of and appeared to have come in quite late. It appeared to be clearly linked to the initiative by the South African Bureau of Standards to make standards on vaping products, and to the fact that the government and specifically the Department of Health was vehemently opposed to it. It appears to say that the department can make standards or can prohibit other people from making standards. But in the NETLAC process, the department said, no, this was just about technical regulations, not about standards. But the problem was that the technical regulations are already covered in Section 15. So now we have two overlapping provisions on technical regulations. And this is not only confusing, it means that once this bill is passed, any proper legal interpretation would say there must be a separate purpose in dealing with the same issue in two different articles, and we may get back to what we were assured in the NETLAC process, that it was not about standards. It cannot be excluded that once Parliament passes this bill in this form, there will be a reversion back to the standards issue. Then there's the issue of undefined and overbroad regulatory powers. This is specifically on new and emerging nicotine products mainly. I think we have to be fair. Probably this draft started out as an updated tobacco control bill, to which the issue of new and emerging nicotine products were added. Probably, likely, not much guidance is available on how to regulate these new products. So it is not unexpected that this bill would ask specifically on product regulation for significant regulatory powers. But what is completely missing in the bill is a framework, at least giving an indication as to how these powers should be exercised. What is noticeable is the fixed application of the precautionary principle as conveyed by the advisors of the department, and their stated intention not to consider either the evolving evidence base or product differentiation. And all of this means that these powers should either be qualified by a proper framework giving some indication of how they should be exercised, or their exercise should be made subject to parliamentary oversight. And there is a mechanism in the South African Constitution for making their exercise subject to parliamentary oversight. My last sentence on this slide is that failing to fix these issues means that the future regulatory processes will be compromised. There will be doubts about their inclusiveness, about their transparency, about them being biased or not, about them being evidence-based, and so forth and so forth. And this is why, in a way, my presentation tonight is not about the final decisions Parliament should make on certain regulatory issues, because I think it would be unfair of Parliament to make some decisions on what has been presented to it, but to create the road going forward for a level playing field, for a democratic regulatory process, for an evidence-based process, and for a non-ideological approach. So on next steps, I believe that there is a serious need to clarify the issues the drafting issues that I have identified. Why? Because the resulting legislation has to meet the legal standards of clarity and certainty. We cannot have a position where the bill seemed to say A before NEDLAC. During NEDLAC, it was described as meaning B. Parliament passes it in the same format, and there's a reversion to A. That would mean that Parliament has not met its obligation to create legislation which is clear and which gives legal certainty and which provides a democratic road ahead for the subsequent regulation that will follow. Like I say, it's not for me I can only ask the committee to do what is within its powers, but I do think that the committee should make substantive changes to this bill, not rewrite the bill, not resolve issues which are currently unresolved, but I will make some suggestions on what I think Parliament can do to fix the drafting of the bill, and they are the following. I believe there should be a reference to our unique national circumstances in the preamble of the bill and the final act. We cannot ignore the fact that we are totally unique in terms of our number of illicit trade, our lack of enforcement of pricing mechanisms, our availability of the cheapest cigarettes in the world. We cannot simply ignore that. We cannot say that the regulator has only one task, which is to focus on the highly priced, closely regulated, small little legal industry that's left, and to ignore the rest. We have to reference the fact that the evidence base is still developing. We cannot have a situation where the precautionary principle was applied roughly in 2016, and the call was made that harm is harm, that the evidence requires a certain amount of caution. We cannot freeze the precautionary principle. There should be some provision in the bill for the possibility of product differentiation based on risk. Now, I can see the ideological debate here. Parliament would say, the government would say, we are being asked to embrace the possibility of product differentiation. I don't think based on risk. I don't think that is the case. But what we are seeing, what we have seen in the NETLAC process, is that there is a very, very high probability that the ongoing regulatory National Monitoring Committee process will stick to what it has clearly stated, what has clearly been stated, which is that all product differentiation on risk will be and has been and will be rejected. I don't think that that would be a good outcome if this bill stays as it is and not at least mentions the possibility of product differentiation based on risk while looking at developments in the evidence base. I also think that the monitoring committee is a very strange animal given our specific type of government, our specific constitution, our specific way of dealing with regulations. I think we should follow what is in the preamble of the bill, saying let's make it a national coordinating mechanism between all the government departments in order to enforce all tobacco control measures. This is the golden route to solving the massive illicit trade and cheap cigarette issue that we are facing in this country. Then I think the Article 5.3 wording and its extension to additional stakeholders should simply be removed. We have a democratic system, we have safeguards, we have openness and transparency. If we want to empower certain policymakers in our country to subjectively apply international law wording in a way that excludes the stakeholders they elected from the regulatory process, then we are getting nowhere. Then the bill actually undermines democracy in the country and undermines the quality of the regulations that will result. My last 3 points is there should be a single section dealing with the power to regulate products. The standards debate seems to be fading, seems to have been denied, could easily make a comeback, and I think there should simply be, in terms of good regulatory practice, there should be one single article on regulation of products. There should be a broad framework. There are court cases in our country, previous legal decisions saying that a blanket maximum undefined power to make subordinate legislation is not in line with our constitution and our constitutional practices. And on top of that, it is certainly not in line with a situation where the people who will isolate themselves in advising the government have already communicated that they will follow an extremely ideological approach. All of this will completely undermine the quality, workability of the regulations going forward, the practicability, and also the unintended consequences that may result. And my final provision that I want to call for is, given the fact that the picture is unclear, given the fact that the powers are very wide, given the fact, as some committee members have said before, that there seems to be a serious breach of trust and trusting between various stakeholders in this debate. In this instance, specifically in this instance, and given the changes in the evidence base, my final call is that the final act will have to exercise the power that Parliament is given in section 101(4) of the Constitution, where it is saying that Parliament can ask for subsequent proposed regulations to be tabled in Parliament and to be approved in Parliament. I think this is a case par excellence where Parliament can exercise this function for the good of the country, can exercise this function for the good of the issues going forward, so that in the end there is a joint path decided in a democratic manner to the benefit of the country and not an ongoing ideological debate. So these few points are the points that I wanted to call for in terms of what I believe can be done to the bill. How it will be done, that is up to Parliament and its procedures. I accept that it's not normal for the bill to only come after NEDLAC at this stage, come into NEDLAC at this stage. The Parliament has a task. My call is that the job that Parliament must do here is to prepare the road ahead for the final regulations, to prepare a democratic, non-ideological, level playing field for the regulation going forward. If Parliament leaves the bill as it is, there will be a reversal to the original intention of intransparency, exclusion, ideology, not amongst all people. To be honest, I don't want to level accusations at whole government departments or even at specific officials, but the overall impression that the wording of the bill and the NEDLAC process gave was that this was a very unique approach, going against the way regulations are normally made. And my plea is, there is nothing lost in doing it in the right way, arguing it in the right way, engaging on it in the right way, and getting a set of balanced regulations and a balanced approach, which ultimately will be best for the country. Thanks. This is my timing, Mr. Chair. I hope I made it. I spoke very fast. Now we can over to you.
Yeah. Mr. Du Plessis, before I open up for members, I want to make a factually an incorrect statement that you raised. I have been the chair of this committee since the start of this administration. There were members of this committee who had the issue about the NEDLAC. The process went from the Parliament to NEDLAC and NEDLAC to Parliament. By the time we interacted with the bill, it had been to NEDLAC. It was the NEDLAC component. Some of the people maybe you represent here that were not happy. They wanted to do a clause by clause on the bill. It's never done by NEDLAC, a clause by clause. So that is why when we get our legal opinion in Parliament, we say, let the bill go and be discussed in NEDLAC, but it cannot stop our processes. And if it could have followed, we will continue with our processes in the Portfolio Committee while Department of Health went back to NEDLAC. So it is not a correct statement that it came to Parliament before NEDLAC. It went to NEDLAC first, and NEDLAC, because there should not be an illusion that any bill like this will in NEDLAC find consensus on all points. It can never be, because this bill for other members of NEDLAC is about business, but other members in NEDLAC, it is about protecting public health. So there was no such a thing that the bill went to Parliament before NEDLAC. Just get that correct. It went to NEDLAC. Only when it was here, they were raising issues and concerns, and they had a discussion again while we were continuing with our processes in Parliament on the bill, among other things, doing public hearings. That is a factual issue around this matter and not the other way around. Okay.
Mr. Chair, I apologize if I was understood incorrectly. The other side of the coin is that in NEDLAC, we were told that it was not standard practice for a bill to only get into NETLAC after it had been tabled in Parliament. I haven't followed up on this. This is what we were told. If my information is incorrect, then I apologize.
Because the bill would not have come to Parliament unless it has gone to NETLAC. It had gone there. It's other members in NETLAC who were not happy that they had to do other things, which is never done. There's never a bill in Parliament in NETLAC that does clause by clause. Never done. It's not the first time there's a bill in NETLAC. But they wanted it treated differently, other members of NETLAC, and it was not going to be treated differently. We do have a legal opinion on this from Parliament. That is why we proceeded with the processes while they were fine-tuning whatever that other members of NETLAC were really asking. Honorable members, this is your space and time to ask. I'm recognizing Honorable Dr. Leroux as number 1, Honorable Michelle as number 2, Michelle Clark as number 2, Honorable Motubatse as number 3, Honorable Sine as number 4, sort of other hands, Honorable Sine number 4, Honorable Dr. Litlape as number 5. Those are the hands I see for now. Let us start to the Dr. Leroux, and members will come one after the other. After that, Honorable Clark, 3, Mutubase, 4, Sine, 5, Letlape. Thanks.
Thank you, Chair, and thank you very much for the presentation. It's been a very different presentation to what we've actually had most of the time. So thank you for your interesting perspective. I just have 2 questions. I think the first one comes into one of the suggestions that you made. You were talking about your suggestion that we to put into the act that we ask for any regulations to come before Parliament. I just was wondering in terms of how that practically would work and how long it would take for those regulations to. Are there any examples of that we currently have in the Parliament? And so yeah, I just want to understand. I think that I totally hear your argument, but I also think one has to balance that with practicality. So would that not, for example, delay things significantly, or is it something that can be done fairly quickly? And are there any other examples of something similar where regulations come before Parliament, where in any other of the departments? And so that's the first question. The second question was just a general question around your concerns that you've raised about clarity, about some of the perhaps ideological perspective language in the bill. Would you use that as an argument to say that if we let the bill go through like this, that there would be legal recourse or legal concern that this might be legally challenged based on your concerns around the kind of structure of the bill as it is currently? Those are mine. Thank you, Chair.
Thank you, Chair, and thank you for the presentation. What were the flaws within the SIA, and when and where did you raise your concerns regarding the SIA report? What was the response from there on? And can you explain where the consultation processes have been flawed? Thank you.
Honorable Clark, please go take honey and lemon now and get under the blanket.
I really need to do that. I'm feeling really.
Okay.
Thank you.
Honorable Mutubatse. Honorable Mutubatse.
No, thanks very much, Chair. You made that mistake that was done by the Chair during the debate because you named me number 4. You're confusing MK again. Sorry. No, thanks, Chair. Chair, you spoke to ideological debate. Can you please elaborate on that? Because I found it to be very deep. So you can clarify us what do you mean by that? And it's It's a very deep issue that you are raising that I would actually want to be put into, because as members of the committee, we are here to assist the country, and we are not actually honed into our respective ideological beliefs. The second issue, you spoke to harm.
Chair,
Honorable
Mutubate.
Honorable Mutubate, we lost you there.
He got cut off.
Okay, take over, Honorable Sine. We'll bring him back.
All right, I'm back.
I'm back. Okay.
Okay.
Thank you.
Thanks. I realized that I was cut off. You spoke to Hamis Ham. Would you say that the Hamis Ham that is being put forward is in itself tacit ban in itself, the way it is been put forward? Thanks very much.
Thank you, Chairperson, and thank you for the presentation. My first question, you seem to suggest that the bill provides for undefined and overboard regulatory powers. Are you aware that ministers are appointed by the president to collectively exercise executive authority? Ministers are elected by the people and appointed to cabinet by the president as provided for in the constitution. They derive their powers from the constitution and national legislation like the National Health Act to make regulations. Ministers make powers conferred on them by Parliament and the Constitution. In my view, you misinterpret the provisions authorizing ministers to make regulations. And number two, Chair, are you aware that the Constitution provides for the applicability of international law in South Africa, and that the national executive is responsible for negotiating international agreements? The FCTC has been ratified and applies in the Republic. Thank you, Chairperson.
Honorable Chape.
Thank you, Chair. I might be all over the place with this because I'm not a lawyer, but I guess the few questions that I would ask, it would be in relation to Article 5.3. It makes reference to the tobacco industry, but it also says according to national law. Now, in terms of our law, we are expected to engage all parties' consent, not just the ones that we like. But in terms of the WHO on this, they say don't even talk to the tobacco industry. I just want your advice in that respect, just in terms of our own laws. We as Parliament, we are engaging with them, but at a technical level, the Department of Health, etc., our Medical Research Council, our scientists, should they be engaging with the industry or not? Article 1D refers to harm reduction. And what does it mean when the FCTC speaks about harm reduction, but we in South Africa, we talk about harm is harm? How does that square up? There's something that concerns me about whether Parliament is being respected or it's being given its powers. There's concerns about the committee and national coordinating mechanism, and I tend to agree with you. But what I'm battling with now is whether this process that we are embarking upon is a waste of time or it will inform policy making. Because despite the fact that we are engaged in this process, the Department of Health has gone out with radio adverts that say there's no difference between cigarettes and vaping products. Now, it looks like what we're doing is superfluous because the department has already made decisions that we are supposed to consider as parliamentarians and adjudicate on. But they are already out there advertising on an issue where we've had enough people come to talk about us about should there be differentiation? Should there be recognition that not all smokes are the same? Because the FCTC is specific about tobacco smoke. Now, what comes out of an e-cigarette is not tobacco smoke. When you have a pouch, there is no smoke. When you have a nicotine pouch, there is no tobacco. But it looks like the decision has been made about no distinction. And that is why the department is already taking out adverts in the public saying there's no difference between cigarettes and vaping. And we are supposed to be sitting here making that consideration. Are we wasting our time? Are we just being, used as dummies when decisions have already been made? Could that explain why we're going to have a committee that sits elsewhere and that parliament becomes superfluous? Those are my questions. And I'm glad that you make this presentation because you may be able to help me with these issues that I'm battling with. Thank you, Chair.
So I feel that Dr. Letape was raising issues that are in-house. I doubt if Mr. Du Plessis is going to assist to answer, because that is something that we need to process here to say, this bill is with us now. There should be less and less engagement of other people into the department about this bill until we have passed it as law. Now, Mr. Du Plessis, you said you were in NETLEC advising USA or business, so you probably would still find it important to bring some caution to us, which we may use. But I am really wondering what motivates you to say once this bill becomes an act and therefore a particular department makes regulations that we should take that away from them and we are the ones who must make or even approve those regulations. Regulations are never become, I see you are making reference of section 101. What is your fear in terms of the department dealing with regulations after this has become law? What makes you to think that it should come to us and deal with that? I was also not aware about this monitoring committee, what it is doing and what it's supposed to not to do. If maybe you can then assist me and clarify us on that part. But thank you very much for your presentation, because it is like saying maybe just to allay your fears, as this committee, we still have a responsibility to get a product from the department via NETLEC and listening to various people, including going to public hearings, panel beat it the way that we are going to do, having listened to you and many others. So a product becomes the final product once it comes from this committee after our debate, having listened to all of the presentations that you and many other people have made. But if you can assist us by this response, I'm sure you can be wrapping up by 8:25. Thank you.
Thank you, Mr. Chair. Are those all the questions?
You still want to have more? Those are all the questions we have for you. You want to have more?
No. I'm mindful of the time and of the members' time. So if that is all, I will move as quickly as possible through them. Is that fine?
Yes, go ahead, sir. Thank you.
Yes. On the first question of Honorable Member Leroux, I think the point about Section 101 of the Constitution is that as this process went along, it became noticeable how people were saying, new issue, developing evidence base, huge differences of opinion, stakeholders with different views, department saying it wants to do certain things, but it doesn't really know what. And then the ideological debates about harm is harm. More and more people came up and said, this is probably the kind of bill, once it is passed, where the regulations, which will actually contain the details, because there are so little details in the bill on product regulation, this is the kind of regulation that should come back to Parliament, and Parliament should assert its right. On whether it has happened in the past, how it has happened in the past, I haven't made a full study on that. I can undertake to see if I can find examples. On this causing a delay, if I look at this bill, which started in 2016 and we are heading for 2026, then I want to say that doing it by the book, doing it open, transparently, makes it faster. It could be a faster process if it goes via 101, Article 101 of the Constitution back to Parliament, because there will be a more speedy preparation, it will be better thought out, and it may actually be faster and more efficient as a process than it just dangling on, subject to legal challenges, subject to challenges about democratic rights, subject to challenges about being excluded, and so on and so on. On the question of Honourable Member Clark, on the SIAS, I personally did not go that much into the SIAS, and I will tell you why. There were serious reservations about the SIAS issue, whether it was done properly the first time, whether it should have been done the second time. But by the time I was active in a NETLAC context, the steadfast response in NETLAC was the SIAS phase was over. There wasn't a willingness to really debate it. I know that the subject is still going on. I'm pretty sure it's fully reflected in the NETLAC report, but I have not personally dealt with that. On consultations, yes, the consultation issue did improve over time, over 10 years. But it again shows me how, had this been done in an open, transparent, unbiased way right from the beginning, it would probably have ended in 5 years. Sometimes we can be our own enemies on this. On the ideological question, yes, there is a very, very strong ideological bias that we saw in the NETLAC process, not on the side of the government officials, but on the side of their advisors. Right through these hearings, you would have heard harm is harm, any level of risk is unacceptable, the evidence base, the issue is fixed. Precautionary principle means that the government can basically just call a certain date and that's it. So there is a strong ideological angle to what is coming from the advisors of the government, and I think it has been raised that quite a few of them are purveying the very ideological angles pursued by some NGOs and also some overseas NGOs to which they are linked. Harm is harm doesn't, as far as I'm concerned, mean a ban, but it means no product differentiation, maximum equivalence, and no consideration of a better, more beneficial outcome for the country and for specifically smokers. And I think that what is necessary is a more open-minded approach. On the powers of the minister, I think the honourable member made the statement that these powers having been conveyed by the Constitution, by the President, that they are now unlimited. That is not the case. There are ample court cases, there's the Constitution itself, there is a hierarchy of powers. And ministers, as powerful as they are still subject to certain controls and to certain other powers. The unlimited power notion is not reconcilable with the idea of a constitutional state or the rule of law. On the question about public international law, it is very, very simple. Article 2311 of the Constitution says that a provision in an international agreement cannot be cannot be exercised in our country if it has not been put into a law by Parliament. If it is self-executing, it must be approved by Parliament. Article 5.3 has neither been approved by Parliament nor put into a law by Parliament. This bill is trying to do it by its wording, but it is not telling Parliament that it is doing this. In the NETLAC process, we were told that this bill is not trying to do this, but the ultimate point I want to make is the wording in public international law cannot be made applicable by any official in the country and then applying it in any way that that official sees fit. This would be a breach of our Constitution and also a breach of the rule of law. Article 5.3, yes, the point about in accordance with international law. Article 5.3 itself contains the phrase that whatever a government does, our government does, or a government does, in terms of dealing with stakeholders, it has to obey its national law. And it is sad to say, if you look at the NETLAC report, that the simple request in NETLAC that words which actually appear in the International Convention confirming that that Article 5.3 has to be executed in terms of international law was not agreed to by the department. And this leads to the gap in trust that we are seeing here. Also, the extension to the vaping industry, again, not in the FCTC text itself, and the subjective argument that what the vaping industry does, it does on behalf of the tobacco industry, does not hold water. On Article 1D, yes, harm is not compatible with the third option provided for in the text of the FCTC, which is harm reduction strategies. And it is this harm is harm, no harm reduction debate should be allowed because of ideological reasons. Some of you may be aware that the Framework Convention on Tobacco Control is meeting again in November this year. And from the draft agenda, there could be serious discussions about what the harm reduction situation is. Then the question about waste of time. Yes, it is certainly disappointing, I think, that while there's the bill for consultation, there is the NETLAC process, there is this committee process, that on a major point of debate in this process, the department has really decided, if the information you are given is right, has decided to campaign on the ideological point of no difference. This again puts in perspective, because if it is true about that advertisement, that is done in the name of the minister. And if what she is doing or he is doing here is factually incorrect, scientifically incorrect, legally incorrect, then there is a kind of a problem here, which I would say highlight the need for certain debate. Then on Parliament, what is my fear on going back to Parliament? Why am I asking for going back to Parliament? Because of the controversial nature of this whole bill because of the controversy caused by the new and emerging products and because of the choices and views expressed so far. Of which one would this this advertisement be an example? There must be a breach of trust if, while a key point is being debated, one of the people involved in the debate or the entities involved in the debate is actually campaigning on radio on a different level, as if the point has been decided. There certainly is, in this case, a fear on the side of stakeholders of there being a bias, a fear specifically on the side of the vaping industry, of being painted in a certain manner, a fear of democratic principles being undermined, and a fear of ideological perspectives simply being applied. This lack of trust, so to speak, I think necessitates the need that this bill creates an equal level playing field going forward. Not the outcome any specific party desires, but a process which will lead to a sound evidence-based outcome. Those are the questions I had to answer.
Yes, thank you very much, Mr. Du Plessis. For us, it has been a long day, but thanks that you have provided us with those responses. We would interact with your report and to assist us in some of the things that we are processing in this bill. Thank you very much. That you would wish that this bill be amended here and there by some of the inputs that we are receiving, including from you. I appreciate that. Thank you very much.
Thank you, and thank you to the members.
Yeah. Honorable members, thank you very much for your long day participation. We'll meet again at 3 o'clock on Thursday. Take a break tomorrow and do other things. Appreciate it. The meeting comes to an end now. Thank you very much.
Thank you, Chair.
Thank you.
Bye. Thank you, Chair.
Thank you.